Okay, welcome to the Deschutes County Board of Commissioners meeting for 9 a.m. Wednesday, May 19th, 2021. First item on the agenda is Pledge of Allegiance. Please join me.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you so much. At this time, citizen input. We do have one direct email to the Board of Commissioners explaining the passion for World Wayside Park, and that's a park right out here. It's discussion about adding parking spots and changing that park. So we want to thank very much Donna Owens for the explanation and the position on this topic. She's not happy that we're doing what we're proposing to do. So at this time, are there any Zoom call participants with a raised hand feature in Zoom? Or any phone calls that are phone numbers that are unrecognized?
One phone number, 1515.
So if you want to bring that person in, just in case, this could be possible public testimony, and so the person with a 1515 on their phone, if this is citizen input for any items not on the agenda, please let us know. Looks like you're off mute.
Tony, this is Brian Steele.
Okay.
For this second.
So welcome, Brian. So you'll be here for the first action item after the consent agenda. So please just stay with us. Okay, at this time, next item is consent agenda.
So move approval.
Second.
There is one proposed change for item number 2 on page 4. It was a mention of a Sun River Lapine Economic Development lunch, and the words mentioned a health lunch. So it's very much economic development focused and not the health topic. So I had made I just changed the words in the printed version in our book upstairs, and I let Sharon know already. So I proposed that change.
Oh, good.
You support that?
Yes.
Okay.
Yes,
Yeah,
absolutely.
okay. Yeah, there we go. So with that, any other discussion? Seeing none, Commissioner Adair?
Yes.
Commissioner Chang?
Yes.
And Chair votes yes. So at this time, action items. Consideration of signature of a restated agreement for the county fair, between the County Fair Board and Fair Association. Dave Doyle can kick us off. Thank you.
Yes, good morning, Commissioners. You have before you document 2021-338, which is a restated agreement between Deschutes County, the Deschutes County Fair Board, and the Deschutes County Fair Association. This is a document that essentially provides the structure for how the annual fair will be operated amongst those entities, also factoring in the whole county budget process and some of those other nuances. So this has been a long time in the making. There was an agreement a couple decades ago that had lapsed essentially, and the parties had been operating for a long time essentially on a handshake and just a course of business. And Jeff Hines had a real role in getting this to happen. Obviously, last year with the COVID situation and the fair being canceled, it was a good time to try to pick this up and see if we couldn't get some movement on it. And I know it was a heavy lift. It was a lot of work. And again, I give Jeff all the credit. He finessed this through and dealt with all the various parties, the Fair Board, the Fair Association, obviously the county as well. And what you have before you is a document that essentially captures, I believe, the working relationship of the past 15 or 20 years with some clarity provided. And at least everybody now knows sort of what the ground rules are, what the parameters are. There's processes in there in case there's any disputes that come up. And we're all very happy with the agreement. I know Jeff's here today, and I believe there's a few folks either from the Fair Board or the Fair Association that we're going to be zooming in as well. So with that, I'll quit talking and let you folks consider signature.
Great. Any thoughts, board members? Or
Commissioners, I would just add, in addition to Dave's thorough summary, as you recall, there was an internal audit done by David Givens the summer before last with a series of recommendations, many of which have been incorporated into this agreement as well. So I know that was important at the time that those be looked at thoroughly and implemented, and they have been and are, to the extent that they're applicable to this agreement, have been incorporated.
Great, thank you so much. A couple thoughts, this is the People's Fairground. We have a great facility in the state of Oregon, and man, do we spin up for the county fair on an annual basis. Very exciting. It is an enterprise fund with its own income and expense kind of balance sheet. And then the Fair Association, what great history. We celebrated 100 years of the Deschutes County Fair. Didn't quite get to 101 last year, so that's what we'd be aiming for now. But that Fair Association is our community members and all the different folks that lead parts and pieces of the county fair. Just a great sense of community as we do it. And then the Fair Board is that entity that's in place, just managing that fair facility year-round, looking at the bottom line, making sure it has its own rentals, and it could be a fair and expo center, so other events that are hosted throughout the year. So, what a positive opportunity to set up for the next 100 years is my thought at this time.
Oh, definitely. I was so happy to attend the work session we had Monday night between the board and the association, working out a few critical details, and it's so nice that we're going into Low this Friday. I am so appreciative of Gladys Sappington. She's been the association president for quite a long time. It looks like, hopefully we're going to go ahead with our rodeo this year and our fair, and being respectful of COVID, but yet we have a great opportunity to have a fair again. Talking to Jeff Hines, I appreciate him, and the fact that we probably won't have to worry about the 300,000 parking in and outs that we've had in the past is one of our giant concerns. But still, if we can have a fair, and definitely we were never going to leave the FFA and the 4-H kids out of the loop because it's critical. They've already having their animals weighed. We're really looking forward to this. So hopefully, and the document being signed, I think it's great. Thank you, Dave Givens, for all that you do, making our county much better operating with real documents. So thank you, everyone who's signed the agreement. I believe it was almost unanimous the other day. So thank you.
It's really exciting to think about us being able to have a fair this year, and this agreement, which lays out how all these partners work together, it does just that. It lays out how all these partners work together, and all of these partners are critical to being able to pull off something like a county fair, especially one on the scale that Deschutes County is able to put together. And so I also wanted to just thank everyone for their work on this agreement and for the signatures that'll kind of codify how everyone is going to work together and make great things happen. Thanks.
So I know Brian Scheel is the Vice President of the association organization, and he's available on the phone. So Brian, hopefully you're able to hear our comments here today. Do you have anything to share? And thank you very much for joining us. So I'm seeing a mute on your line at this time. There we go.
Hey, Commissioners, sorry about that. Yes. Thank you for your giving me the opportunity to speak. Just want to say, this has been a long time coming. We have been, as the association, 100 years of putting off this fair and rodeo, and we love what we do. Every single one of us look forward to our time every year to give back to the community and do what we do in the best way possible for the citizens of our community. So thank you all very much for all your hard work on this. It's been a tough haul in some places, but we're getting there, and we're all looking forward to what comes next. So appreciate all your time and effort, and kudos to Jeff and all the county commissioners and county board members that have helped get this thing where it's at today. So thank you all.
Great, thank you. So kind of two modes today. This is a document that we're proposing to sign, but then also the discussion of the county fair and what we think it may be this year. It's really changed around drastically in just the last few days with the COVID restrictions changing. So Jeff, do you have any comments on the document itself? Because then, as I say, we'll switch into the vision and opportunity of having a fair this year also.
Yes, Commissioner DeBone, or Chair DeBone, and Commissioners, thank you. And thank you to all those who joined us. I think there may be a member of the Fair Board joining as well, with Steve Curley as the Vice President. Was going to try to join this morning as well. Steve was integral in this agreement, as was a number of other members on both sides, the Fair Board and the Association. Tremendously appreciate the guidance of Dave Doyle in helping draft this agreement. On the Fair Board side, certainly David Bishop and Steve Curley, Aaron Curtis and Carrie Novick, who really kind of spearheaded that group. And on the association side, their work group of Brian and Mike Scheel, Gladys and Alton and Rachel really came together and took a number of months to put this agreement together. And it went through numerous iterations and very careful review in order to make sure that the words that are in this document are appropriate and necessary and relevant, and that they're important for the next century of moving forward of the Deschutes County Fair and Rodeo, and really sets the standard for what we have been able to do. Looks back to what we have been able to do and sets the standard moving forward for the next 100 years of success, and gives us that baseline to move forward. So just as everybody else, I echo the comments of appreciation of all the parties working hard to make this this document to this point, and I'm hopeful that it also meets your support for each of you. And certainly, if there's any questions, happy to answer those at this time.
So I see Cruz.
I was just going to ask Jeff, is it 70 days till the fair now? No, it was 72 on Monday night.
Yeah, so I believe we're at 69 at the end of today, yeah. So
Okay, all right.
around the
So
corner.
I know they're going to be working really hard.
So Steve Curley, you've been welcome to our Zoom meeting, so thank you for joining us. And yeah, you're currently on the Fair Board also, so if you have any comments.
Yes, thank you, Chair DeBone and Commissioners. Just when you go last, everything's pretty much all been said, but there were a number of parties that made this possible, and the Fair Board is thankful for the Fair Association and the support of the county commissioners. This document formalizes the agreement between the Fair Association and the Fair Board, a partnership that has been recognized, that's been around for 100 years. And so we're very grateful for all that got us to this point and look forward to moving forward. We're very excited about putting on a fair or a modified fair this year. And so looking forward to that and that discussion that you will be having here in just a few moments. Thank you for the opportunity.
Great, thank you. So at this time, how about the business of this document, if there's a motion?
Did you make the motion?
I'd be happy to. I move that we approve chair signature on the restated agreement, document number 2021-338, between the county, the Fair Board, and the Fair Association.
And I'm most delighted to second that.
Okay, any other discussion? I think a lot's been said already. Seeing none, Commissioner Chang,
Yes.
Commissioner Adair,
Yes.
and Chair votes yes. So very exciting. This is a piece of paper that puts it in place. 1916 was a county was created as a succeeding from Crook County, but 3 years later we started the process of having a county fair. So that's why it went to 1919, and then 1919 to 2019, and then 2020 we missed it last year. So, but we got to 100, which is interesting. It's a kind of a round number. We skipped a year, and now we can step towards what does 101 look like. So with that concept, Jeff, maybe if you want to kick off, or whoever.
Sure, I can start. I think on behalf of the citizens and the community here in Deschutes County, the entire team at Deschutes County Fair and Expo, and the partners that we've referenced today, the association and the Fair Board, are hard at work at coming up with a plan that will provide a safe and responsible and relevant community event and celebration. Certainly we understand that there may or likely will be modifications required in order to produce an event this year, and with many unknowns still, with right at 70 days until what would be our traditional opening day, there are some challenges that still need to be overcome, and the potential that fair or an event may not look exactly like it has in years in the past, and that's something that we're working very quickly to get our arms around, and working this week to come up with a finalization of a plan. As Commissioner Adair mentioned, going into the low risk category certainly provides us additional opportunities and activities that we believe we can provide back to the community, but recognizing that there are some that just may not be possible, either due to the limited timeframes that we have in order to try to pull things back together, and or the restrictions that are still necessary in order to keep our community safe in the time of a pandemic, when we're trying to produce a large community event and bringing parties together to celebrate. And we're certainly cognizant of the fact that whatever we do needs to be done safely and responsibly, and that will be job one. And then job two will be to make sure that what we produce is an event that's enjoyed and respected and relevant to our community, and something that we can be proud of and give our community an opportunity to celebrate, that I think that we all need after the years we've had.
Absolutely. So, and as I say, Brian Shields on here. So the association, I know this has been a point trying to get to this, the concept of having a fair this year, and just a couple days ago it was off and then it was back on. So it is that dynamic. I can sure acknowledge that. So yeah, Brian, any thoughts or something to share?
We as a county fair association, we've been dealing with what everybody else has been dealing with, inconsistent or unknowns, and lots of can we not, can we go for it, if not go for it, what their starts. And so, we're just happy to see things moving in this direction, and we are all looking forward to putting on the best event possible. So every one of our fair board members, fair association board members, and volunteers are geared up and ready to go and do what we can to put up a great event.
Wonderful. And what are the dates of the fair? I mean, this is kind of it right now, publishing the dates and saying we're going to do something.
Yeah, so dates of the 2021 annual fair would be July 28th through August 1st.
Great. So that's great for the community to understand that we do have something to look forward to. I do think of all the FFA and 4-H, but I mean, just the open class of preserves, vegetables, and pies, just all that fun stuff to be able to look at, the projects in the areas, possible concerts, maybe definitely different than in the past. I mentioned to Gladys Sappington that this could be a premier rodeo event, as in we know how to do a rodeo, and if that falls into place, that could be the big attraction, having a premier rodeo event here in Deschutes County in those dates. So.
Yeah, absolutely. And as I said, our team is working hard. We're playing a little bit of catch up, and we're ahead in a lot of ways, and behind in numerous others, and figuring out what we can do and what we can do safely and responsibly, and definitely excited that we're moving forward with more details to come in just days. So we'll be excited to share those with you and the community.
The booths and the vendors, oh my goodness, a lot of moving parts. So let's make it safe, but let's plan on a wonderful community event also. Anything else?
No, just thank you so much for moving this forward, Jeff.
Jeff, I so appreciate your knowledge and expertise of the square footage of all the buildings. And Monday night, he's like doing one of the barns, and he's back, he's saying, well, we could really have 425 people in that building, but because we've got cages, we've got to take those. I mean, your expertise is unbelievable, considering you haven't been here that long, and you've actually only been to one of our fairs. So I thank you for your leadership. I know you're going to be working individually with a lot of teams, and thank goodness those people really love and know their jobs, and they are so willing to adapt to today's world. What is it we can do? But really, to have our fair, I think it's unbelievably important to our community. So thank you.
Great. So Steve Curley, any other comments?
Just want to echo what Patty said, in that the Fair Board has a lot of confidence in Jeff and his ability to make this happen at the highest level that will be safe and will be allowed. There's a lot of things you can't control, and we've learned that in the last year and a half, and we will focus on the things we can control, and the things we can't control will be flexible. And I'm confident that the event that's produced will be of high quality and will be very welcomed by the community. So we're very, very much looking forward to what that is.
Great. Thank you so much. Well, it sounds like we'll leave it there. The dates have been mentioned, and we're going forwards. Thank you so much, everyone. We have a completed document, and we'll go from there. Have a great day.
I know you're going to be busy.
Yeah, let's not keep them any longer. At this time, item number 5, consideration of signature of an intent to award contract for engineering services. Cody Smith.
Good morning, everyone. Cody Smith, County Engineer, Deschutes County Road Department. The intersection of Deschutes Market Road and Hamehook Road, one of our busiest intersections on our county road system. Deschutes Market Road, this year, we've measured an average daily traffic of approximately 8,900 vehicles per day. That's on the north leg of that intersection, while on the Hamehook Road, which is the east leg of that intersection, average daily traffic of approximately 3,300 vehicles per day. The Deschutes Market Road, Hamehook Road intersection improvement project, which will consist of constructing a roundabout at this intersection, was identified as a high priority project in the county's transportation system plan, due both to intersection capacity as well as safety. In the most recent or most readily available 5-year period for crash data, which would be the years 2014 through 2018, we've had 11 crashes at that intersection. 3 of those were injury crashes, and another 4 crashes in close proximity to the intersection on the approaches, on the Deschutes Market approaches. So the road department issued a request for proposals for design, engineering, and related services for the project back in January. 3 proposals were received in response to that RFP. The department scored those proposals using a qualifications-based selection process. The top-ranked firm from that process was determined to be Harper, Hoff, Peterson, Regelis, Inc. So before you this morning is a notice of intent to award a contract for those engineering services for the Deschutes Market Road, Hamehook Road intersection improvement project to Harper, Hoff, Peterson, Regelis, Inc., or HHPR, with the not to exceed amount of $398,194.32. Issuance of this notice of intent to award would start a 1-week protest period for interested parties to protest award of the contract. If no protests were received during that period, then the contract would be awarded administratively. Current estimate for the total project cost is $2,293,194. Road Department anticipates that design for the project would kick off within the month of June, and construction of the project would begin in the summer of 2022. And with that, I'll turn it back over to the board, and I'm happy to answer any questions.
Any discussion, any questions?
Oh, Cody, I just was wondering, have we ever had a protest? I know we're given a 7-day period, but okay, I've been here 2.5 years. Has anybody ever protested?
During my tenure with the Deschutes County Road Department, we have not had anyone protest a contract award for a road department project. I believe prior to my tenure, we did potentially, there might have been a protest for a construction contract. That was a few years before I started here. Outside of that, as far as other departments, I couldn't tell you.
I was just wondering, but yes. No, I know it's good that we're going ahead with it because it is a high priority.
Yeah, another really important intersection, another improvement that we're making to keep up with growth. Thank you.
Okay, is there a motion?
I move for chair's signature of document number 2021-050.
I second.
Okay, any other discussion? So one concept, this is the public process of this contracting. So, there's multiple steps, and there's already been a letter gone out to the applicants in this process notifying of this notice of intent to award. So this is the public meeting, letting anybody and everybody out there know that we're going through this process. So it's very empowering to know that, we're doing some great estimates and engineering estimates before it happens. And then these are the professional organizations providing feedback and the true costs in the industry. So very good process. So at this time, calling for the vote, Commissioner Adair?
Yes.
Commissioner Chang?
Yes.
And chair votes yes. Thank you very much.
Thank you.
Item number 6, economic development loan request. Whitney Hale. And Caprielle Lewis from Sisters Economic Development.
Yes, thank you, Commissioner DeBone. For the record, Whitney Hale, Administrative Services. This morning we have, we're joined by Caprielle Lewis from Sisters Area EDCO with an economic development loan request for the board's consideration. This is a request for a loan in the amount of $12,000. I'll go ahead and turn things over to Cappy here in a minute. I do believe we may have a few members of the EDCO Due Diligence Committee joining us on Zoom.
We might need to name them so they know who to bring in.
So I think if Bruce Barrett is in our attendee list, and Cappy, I believe there was someone else that may be joining us as well? Okay. Okay, so if we do see Bruce hop in Zoom, we can go ahead and move him over. I just wanted to let the board know there is available fund balance in the Economic Development Fund to support this loan. As you'll recall, the board approved 2 loans in April, one for a Redmond area company and one for a Bend area company. Current fund balance accounting for those loans which are in progress is a fund balance of $123,000, just over $123,000. I also just wanted to remind the board that during your video lottery allocations, you did approve a transfer of funds into the Economic Development Loan Fund, which will support future loan requests, which will be brought to the board in fiscal year 22 and then in the remainder of this fiscal year. So if you have any questions, I'm happy to answer them, and if not, I'll turn things over to Cappy. Commissioner Adair?
No.
Okay.
I'm like, okay, we've got
I
money
started
allocated to
speaking
Bend and
your
Redmond, so
language
now we're
with
doing
the
something
budget,
for
so. All right, thank you. Go ahead, Cappy.
Thank you so much. Good morning, Commissioners, Chair DeBone. Appreciate the opportunity to be here this morning in person. And very excited to present this opportunity to you, to introduce you to a company that's been working to relocate to Sisters since 2016. This company is Holy Cacao, and they are a premium producer of delicious organic chocolate sauce, coffee syrups, and cocoa powder for the coffee industry. This industry globally in 2020 was over $102 billion their market value. So lots of opportunity for this company to expand. They are specialty food and beverage, which is a target industry for the state and the region, and a great fit for Sisters. The founder is driven to make a positive impact in society by creating new jobs in Deschutes County with excellent health benefits, very health-conscious company, and motivated to have a premium health benefits offered to his employees. The new production facility is just over 5,000 square feet. They have invested in that building. They will be leasing that building. It's a new build-to-suit building in Sisters. Total square footage of that building, which is now considered spec for Sisters, is over 17,000 square feet. So great new capital investments happening in our business park. Their equipment costs are going to be over $162,000 with additional $35,000 worth of tenant improvements. So you start looking at those investments for a small company of only 7 employees, and they're invested in significantly in the county and in Sisters. These investments will increase the tax base. This company's main customers are in the coffee industry are coffee roasters and cafes and allied product distributors within the coffee industry. They continue to see healthy revenue gains. They did have a hiccup last year with the onset of the pandemic and some closures, but they worked through that, focusing on new customer accounts and some new product development. So super exciting in that regard. The funds would be used to purchase and upgrade additional manufacturing equipment for these new products and increase production efficiencies. They're also focusing on third-party food safety certifications, which would open their abilities to hire larger customers and clients who require these types of certifications. And so the loan, if approved today, would be very impactful for this company and meaningful. They expect to continue their revenue growth at over 25% per year, year over year. This company is a perfect fit for this program in terms of the expectations and the intent of the program. Long-term, higher wage, non-seasonal, full-time, traded sector jobs in Sisters in Deschutes County.
Well, that's exciting to have a company that's motivated to come, and the new building and the new investment, the new tax base, it's all going to be complementary to each other. So it's very exciting to see this opportunity. I know these dollars I do support for kind of that transition, some of those last dollars in for an incentive package for people that have committed to coming, and then the goal of those living wage jobs. What a wonderful opportunity for folks to be able to work in that industry.
Cappy, can you tell us a little bit more about the work, the jobs, what will the workers be doing that are kind of identified in this proposal?
Yes. Well, the exciting news is that the Maiden Sisters event this Friday, this is a company that we will be highlighting. So you'll get an inside peek at exactly what their production is and who they're currently hiring. So production manager, number one, and operations. And then and there'll be different levels of career paths within the organization, within the company. But yeah, it's a lot of it's handcrafted. They've really started with this sort of niche of being handcrafted, premium, organic, all responsibly resourced ingredients, and focus on sustainability as well. But it is literally big pots that they heat up, and then they pour the cocoa powder in and mix it with some of their proprietary ingredients and so on. But there's when I was there, we were able to watch them do their magic with their chocolate sauces, and then they're hand bottled. So really, this is a small growing, and they've been growing steadily since 2008. And they had interest in Central Oregon in 2016. So I've been working with them a long time to get them over the mountain. But yeah, it's small and just growing, and then they really do see themselves as already kind of looking ahead as expanding with additional production equipment. But yeah, so all levels of production.
Yeah, great. Thank you so much for your work to help our community welcome this exciting company.
Yes, as someone who consumed chocolate almost every day of my life until January 2nd of 2021, yes, I can say that, yes, I'm so glad they're here.
So is Bruce Barrett with us possibly? So, and that's fine. So we do have a due diligence committee that does kind of look over the finances and understanding the reality of the situation to kind of confirm that this is a prudent investment in these dollars.
So we met multiple times, met with the owner, vetted their financials, and we are confident in their capabilities and would not have recommended it if we weren't. But owner's a conservative business person, very, very conscientious, and we're going to see good things from this company. So.
That's exciting. Okay. Is there a motion?
I move that we approve the amount for economic development loan of $12,000 to Holy Cacao.
I'll second.
Any other discussion? Seeing none, Commissioner Adair?
Yes.
Commissioner Chang?
Yes.
And chair votes yes. Thank you very much for joining us. Congratulations.
Thank you so much for your support for Central Oregon and for Sisters. We greatly appreciate it. Thank you.
It's great.
I'm so glad they're going to be a sponsor on Friday. So great to hear.
Having only been here for 5 months, it's exciting for me to see these economic development loan funds go to different parts of the county.
Mm-hmm.
So, thank you.
So at this time, we do have 20 minutes before a time-certain COVID-19 update. I guess, Tom or Dave, would there be any of these agenda items to pull up, possibly? Or? I don't know that. Stay on
Can
the-
I say something as
Oh, please
other
do.
item?
Yes, please do.
Because we had our EDCO meeting yesterday in Sisters, and then I was seeing something from COVA, and the call yesterday morning, AOC is working on a letter, getting together all counties. It was actually coming from Morrow County, the request that we all sign a letter, send it to the governor to stop the $300 a week in federal unemployment. Our entire state is, what is the word, being impacted by the lack of employees. So I know that Gina Nichols is working on that letter, and everyone on the call yesterday, that was the major contention. Nobody can find people to work, and in fact, and between that and the housing issues, it's really a nightmare. So anyway, that's what all the business owners on our call with Cappy yesterday were saying. It's just, yes, frightening.
It's definitely a time of transition and an issue, having motivated workers. You think of a person working, hopefully they're able to make ends meet, but there's a sense of identity and pride in working hard also. So we have got to get back into that motivational, provide a service or a product and a sense of identity for, employees and anybody in our community. So it is a time of transition, that's for sure.
I guess I would just say that at the EDCO board meeting, so the regional EDCO meeting last week, there was a lot of discussion about the hiring challenges in the region, and the unemployment benefits were one factor that was mentioned by some of the speakers, but there was a variety of other factors that were also mentioned. And during that meeting, I didn't pick up from the board members who were gathered that there was any kind of a push to make a policy statement like this in relation to unemployment benefits. And in fact, one of the things that I specifically heard from some of the speakers was these additional benefits will go away in a few months. So if we're concerned about the impacts that they're having, we can essentially wait them out. So I just wanted to kind of share that back on this topic.
Well, I can say that Dan Young from Metabolic said lack of applicants. Don from Laird's Superfoods, so few applicants. And these benefits do go through our whole entire summer season. They're being paid till September 6th. Yes, it was pretty consistent. And then I saw the letter from Julia Thiessen either last night, or I think it was last night, about, oh my gosh, we've got to do something. Their industry is so shortchanged.
We absolutely have we have hiring challenges right now. I'm not disputing that. What I'm saying is that there are multiple factors that contribute to that. We had, before COVID, we had a very tight labor market, and as we come out of the economic impacts of COVID, we're going to have a tight labor market. We have an affordable housing shortage, we have a child care shortage, and we have a number of other factors that contribute to the current current hiring challenges. So just saying that unemployment and benefits are not the only factor.
A couple other thoughts. So we have the East Cascade Works Consortium, which is the WorkSource Oregon employment training and employment training opportunities. So that's an effort that's going on. So anybody that is thinking of career changes or career readiness, there are definitely opportunities out there, and you can do that while on unemployment. So if somebody's out there thinking about what's next, please reach out and try to find that next career, something that's really meaningful, as employment for yourself. And then also, I mean, just think of individually. Now is the time to get engaged, to be able to just get that sense of pride, but experience also, because there'll be opportunities to move up in just about every business that's out there these days. If you are ready to step in and you know, provide those career, you know, opportunities for you individually. So, very, critical time. I did speak to the management at Black Beet Ranch, and they said that you know, they've got golf courses, pools, and restaurant opportunities for people, and they're just not finding anybody to even get near it at this time. And we've got a crush of people wanting to come to Central Oregon and be tourists and be recreationists, and we just don't have the staff to do it. So that is the reality of the situation.
And that was Sean, and he was on our call too. Yes, you definitely repeated those total comments. They were trying to fill 100 positions, and his comment was people have been incentivized to stay home. Anyway, it's, you know, I've heard that, Jackson's Corner, one of the restaurants in Bend, one of them had to close because they were short. The restaurant in Sisters is going to close one day on Wednesdays because they're short of employees. Yeah, it seems to be pretty much all over, and you see it in the market. They need everybody. There isn't a position that isn't mentioned on the door when you walk in, and they're there with the table, trying to interview people, and nobody is stepping up.
So we should watch carefully what unemployment rates in our region are doing, so that we understand how much of the constraints that we're seeing are related to a tight labor market and how much may be related to other factors. And I do hope, understanding that factors such as housing affordability and childcare availability really are affecting our workforce, that when it comes time to allocate out funds from the American Rescue Plan, that we are thinking about what we can do to set up our region to be more successful with matching workers to jobs using those dollars.
Good discussion. Thank you very much. So at this time, I noticed Nick Lilac joined us. We do have an agenda item number 9 that we could bring up before our 10 o'clock COVID update. I think that's being offered by your presence.
If you wish, Commissioner.
Okay, yeah. Just confirming.
Commissioners, I did get obviously a text from Nick, told him to come on over if there's time. I also got a note from Nahad that they're ready to go early, but since that one was kind of published at 10, you may want to, assuming you can get through the CDD work plan item and by 10, that sounds like a prudent path to go.
Yeah. Well, let's do that. Let's step into item number 9. This is the draft Community Development Department fiscal year 21-22 work plan and 22 accomplishments document. Nick Lilac.
Good morning, Commissioners. Nick Lilac, Community Development Director. In your packet, we have a memorandum summarizing the deliberations this morning that provide a series of options for the board to consider in terms of affirming the Planning Commission's recommendations as proposed or potentially as modified or changed by the board, or any changes, of course, that the Commissioners would like to see this morning. I'm happy to summarize any of those. I just also want to point out that the Commission received, that the board received 2 emails after last week's public hearing from Nunzi Gould and from William Kuhn. I'm happy to address either of those if you wish, or if you've reviewed those and have considered those, then we can certainly proceed to deliberations. The focus of the deliberations is really on Table 2, the Planning Commission's recommendations, and as pointed out in the staff report, the Planning Commission prioritized some of their recommendations. The board traditionally has not prioritized projects in the work plan during the work plan process. Generally, that occurs over the course of the year as we meet with the board to discuss available capacity and what the board's priorities are at the time. So I'll conclude my comments and make it brief and turn it to the board and answer your questions and assist as you wish.
Sure, and I'll just acknowledge this is deliberations towards accepting and documenting this as the 2021-22 work plan and the accomplishment document associated. So it's already a valuable product, just getting to this point. And this is the deliberations of the Board of Commissioners for the input we've received. Any thoughts?
I just wanted to clarify my understanding of the items on this in this work plan. So in the in-process list, there are a number of items I'm interested in, and I just wanted to make sure that I understand what's happening with them. So things like the guest ranch text amendments, the natural resource stewardship position, the consideration of limiting hemp production in rural residential exception areas. These items appearing in the in-process column in this work plan indicates that essentially we are deliberating, the county is deliberating on these items, not that we have chosen a specific direction yet on any of these items. Is that accurate?
That's accurate. Our department, and we have a department staff currently working on each of these projects. Some are still pending before the Planning Commission. Others will be presented directly to the board prior to the end of the fiscal year, the end of next month, by June 30th. That's correct.
Okay, yeah, because I'm going to find the deliberation on those items really interesting and look forward to, just wanted to make sure that we weren't kind of towards the end of the process on those items already.
Many of these processes are someplace in between, and some of these will, when we present them to the board, we'll ask questions about what next steps you're interested in our taking, and we'll provide options for those to the board.
Thank you.
So could you summarize the 2 bits of information provided since last week from the 2 folks?
Sure, I'm happy to. So Ms. Gould provided an email with several questions. One was requesting the county to reconvene the Code Enforcement Committee. As we update the code enforcement, what we refer to now as Code Compliance Policy and Procedures Manual, we met with the board in January, decided at that point that we were going to work board staff at this point, and then we'll have a public hearing. So certainly Ms. Gould and anybody else is welcome to participate in that hearing.
And I support that, the plan as we've defined it. I understand her request. So I guess just making sure that we're receiving that, acknowledging it.
Exactly. Point number 2, please adopt the wildlife habitat inventories as identified in the story maps, et cetera. So we're in the process of completing that grant project this month. We will then meet with the board next month or in early July to present what we've heard in the public comments and the town halls, et cetera. And then at that point, we'll ask the board, would you like to proceed with considering amendments to county code, et cetera, and the comprehensive plan to adopt those inventories at that point, or is that something that the board would prefer that we include in the comprehensive plan update? So forthcoming decisions on that. Yep.
Oh, I would like to make just a personal plea to the public. I've seen a lot of deer being hit and killed recently. They seem to be traveling, so please slow down. If you see one deer, there may be more thinking about crossing the road. I just saw one hit, I think it was Saturday afternoon. It's really sad. So, we need our inventory.
We need them so we can inventory them.
I know. I haven't seen any babies yet, though. I mean, we have our own little personal herd, but I haven't seen any babies. So,
thank you. Number 3, turnaround time on permits should not compromise completeness of permit reviews. We certainly appreciate Ms. Gould's perspective. It should not all be about speed, but also about comprehensive reviews and really taking the time necessary to complete the reviews and the decisions. And I appreciate that perspective. We certainly take care to make sure that we perform the tasks necessary to ensure the applications are complete and that we spend the time necessary on the reviews. Number 4, improving satellite imagery to be current when viewing dials should be a priority. This is something we can certainly share with our information technology department, since they're the ones that we coordinate with on the imagery. And then number 5, adding technology during the pandemic is valuable, such as to assist with Zoom for remote participation with residents. And we completely agree. We have, in the community development, every expectation that we'll continue to use Zoom or whatever the platform is that the county is utilizing at the time, because we have reached so many more people that it's so much more convenient to them in their homes and around the county. So we certainly, in the Community Development Department, anticipate continuing to offer that.
Yes, thank you so much.
And Mr. Kuhn asked about just making sure that disclosures on property include both the underlying zone as well as the overlay zones for the properties, and particularly with the wildlife habitat inventories and the wildlife habitat overlay zones. Peter Gutowski has looked into that, and it is his understanding, it is our understanding, that those should be disclosed. And so what we will do is we meet monthly with the Central Oregon Association of Realtors, as well as the builders, and we're certainly happy to have that conversation with Tyler Neese, their representative, to just make sure that if there are any issues with that, anything that we can provide, or just share any information about making sure that that process works correctly.
That's great. Yeah, so those are all good suggestions. Those are basically, we acknowledge, and they're all in the works one way or another. So that's pretty exciting. So for Table 2, getting back to Table 2, when we see a list of 1 through 8, would you, when you say that this is our discussion item, moving the priorities around, is that kind of what you're thinking, or acknowledging each one should be on the list? Because I do support each one being there. I might propose a different priority, but on the other hand, it's kind of just a very much of, we're going to knock them off as we can. So I'm just, as a work product, is there intention or a request to change anything in that list?
I'm really excited to see everything on the Table 2 list, and similarly, if this was a priority ranking, I might have things that I would want higher or lower on the list, but just the commitment that they're on the list, and we will work on them as we can. And I know that the Community Development Department has a really good track record of getting stuff done that's important to the community. So
I just want to say, if Senate Bill 391 goes through, like, I would put item 3, like number 1A or something. I mean, that it's got to pop up, and we have got to follow through with that as immediately as we possibly can, Nick. I mean, we have been studying that issue for, years now here in Deschutes County, and those 9,800 opportunities for 900 square foot cottages next to a main residence on at least 2 acres of property, not EFU property, but in the county, it could be such a game changer for our entire workforce and our community. So, yeah, I mean, it's only a month away before we'll know, or is it going to be sooner? I mean, is there still hope?
There's still hope. They're meeting, the House Committee on Housing is conducting their deliberations and what they refer to as a work session tomorrow morning.
Right. Okay, so let's...
And Commissioner, just so you're aware, we have informed the Planning Commission throughout the process, and we have a note in our comment section here that if rural ADUs are allowed and prioritized by the board, capacity may be limited for some other projects. Certainly not all, but for some, because of the priority.
I know, I just
so that
think
we
it's
address that.
The most important thing we could be working on, affordable housing, affordable housing, affordable housing.
Thank you.
Yeah, people are working from elsewhere, working here. That's what I was hearing. Like, they're hiring, one of the businesses and sisters was hiring someone, and because they couldn't find housing, they were working from their home. So it is a serious issue.
So a couple thoughts. Number 4, outdoor and greenhouse lighting control ordinance to comply with technologies and updates. I'm just showing support for that. As I say, that was kind of the discussion, would we change a priority or not? So if we end up with a subset of projects, maybe there is a consulting opportunity or capacity discussion in the near future. So my point is, I do support that. It'd be obviously, as we're building out Central Oregon at a breakneck speed, this would be better to have this discussion earlier than later. So as I say, I'd like to see that it's on the list. What are the estimated opportunities for ADU? What's the kind of the official statement for the parcel numbers at this time? Because Commissioner Dare just mentioned a number. Do we have a number like that we kind of estimate?
The general number that we've estimated, and Central Oregon Land Watch provided one number, we provided a number, and we've reconciled those numbers. It's up to about 9,800 potential properties.
That's our magic number.
Our initial estimate was about 7,000 properties, and the only reason it was lower was that those are the homes that would meet the standards today, that it appears, that already have a single-family dwelling. But there are an additional up to 2,800 properties that are vacant, that they could accommodate both a home and an rural accessory dwelling unit.
That helps, yeah, just remember what we're talking about here, the scope of what's possible there. Thank you so much. And then number 8, support community organizations' scoping of a community energy plan. As I say, I've done a little bit of research on this, and it was mentioned the Hood River Energy Plan as being a published document. But scoping is definitely where I'm at on that. I mean, just taking maybe a quarter step into it and just defining who would refer to what aspects of energy usage, so that, as I say, that I like the idea of scoping in that, because as a sitting commissioner, I really want to understand what domain are we even talking about there, because it can be anything.
Commissioner, we completely agree, and this is a supporting role where other agencies and other organizations would lead this, and they've just asked that we support them in their efforts. So this is just limited to scoping.
Yeah, I appreciate that.
Yeah, and they're doing it whether we're involved or not, so better to be at the table.
Great. So, thank you very much. This is deliberations in proposing.
I could ask one more question.
Yes.
So, there's item number 8 in process, and item number 3 in ongoing operational activities. I think speak to each other. So marijuana inspections under ongoing operational activities, and reevaluating annual reporting requirements for marijuana operations. So when we reevaluate annual reporting requirements for marijuana operations, we will discuss the desired inspection regime for our limited number of existing marijuana businesses. And is that right? So the one item might affect the other item workload.
This is correct. So we are finding the number that we're currently working on, which table that was. But we just met with the Planning Commission last week to discuss marijuana retail operations and the annual reporting inspections. They provided some recommendations to the board, so we'll be bringing those back to the board next month for you to decide whether we should initiate the text amendments for retail operations, and then whether we should consider any changes to the annual reporting and inspections. That's one project. The other project are the marijuana housekeeping amendments that the board has already adopted.
Great.
Did I answer your question correctly?
Absolutely, yes.
Okay.
Thank you. And I mean, I'll just say that, if we are spending our finite human resources on inspecting the licensed, permitted businesses who have, done, have had exemplary inspections to date, I would rather us use those limited human resources to be tracking down illegal marijuana production operations in the county, rather than continuing to inspect and inspect again, people who we know are good operators.
Mr. Chairman, and Nick, if I may, can I offer just a follow-up response to the marijuana retail hours? And
yes.
For the record, Peter Gutowski, Deschutes County Planning. The Planning Commission did offer some observations and make some recommendations concerning marijuana retail and annual inspections, and that's actually scheduled with the board next Monday. Again, it's just it's a check-in moment with the Board of County Commissioners to seek any further direction, but the Planning Commission held 2 work sessions, one in April, one in May, to discuss both matters. So where staff will be seeking direction if and when the board is ready to provide that as earlier as next Monday.
Coming around.
Thank you.
Okay, so as I say, this is kind of the formal acceptance and adoption of this work plan and accomplishments report. Are we ready for that?
There are a couple of draft motions on the back page, if that's helpful.
Yeah, I guess so we have our agenda, we have this document, so what back page are you referring to?
Yeah.
Oh,
Right, of
maybe
of
the,
memorandum of the.
yep, so the third page of it, maybe from our point of view, or, well, no, I don't know.
Page 34.
Okay. There we go, bottom of that page.
Okay, so I move to approve the CDD for your 2021-22 work plan as recommended by the Planning Commission.
I second.
Any other discussion? Seeing none, Commissioner Dare,
Yes.
Commissioner Chang,
Yes.
and Chair votes yes.
Thank you very much.
Yeah, so, because the other option would have been with amendments. I was just trying to understand what was on there, too, yeah. Okay, thank you. Very good. Thank you for being flexible this morning.
Great to
We
know what's on the
appreciate
work
it.
plan for the next year.
So at this time, instead of a little early, we're going to be a little late, but our COVID-19 update, thank you for joining us. Nahad Sadar Zodi, Molly Wells-Darling, and Emily Freeland. We do have Facebook Live and interpretation services.
Good morning.
Good morning.
I'm waiting for Emily. Okay, and Mike Johnson as well from St. Charles.
Okay.
For Commissioner DeBone's request. Well, good morning, commissioners. Good morning to our committee members as well. I need to, let me remind myself to share my screen.
There we go.
There we go. You figure by now I would have this down. Thank you again for inviting us, commissioners. For the record, my name is Nahad Sadra Zodi. I'm the Director of Public Health for Deschutes County Health Services. I'm joined by Molly Wells-Darling, who is our Incident Commander, and Emily Freeland, who is our Operations Section Chief as part of the Incident Command or Incident Management Team. Also, Dr. Mike Johnson from St. Charles has kindly agreed to join us for a quick update on the healthcare system at St. Charles. So let me just start off by thanking my colleagues Jesse Terpstra, Carissa Heineke, and Morgan Emerson for helping with these slides. Also, I want to express my gratitude to our health services staff and community members. Especially, I want to call out colleagues who are populating call centers, in public information and education, community engagement. There's a lot of effort behind the scenes to engage the community members, respond to their inquiries on a timely basis, and invite the community members to be part of the solutions. So there are a lot of people behind the scenes doing that kind of work, and I want to acknowledge them. So let me start off with some good news here. It appears that we have met the criteria for moving to low risk, which comes with obviously increasing economic and social activities. And I just want to highlight that this is really not happening by accident. There is a cause and effect here. First and foremost, the community members, our partners, and the incident management team, health services staff have done an incredible job of getting around 65% of those who are eligible vaccinated. And this feat was through deliberate planning, execution, and hard work, and of course, community demand for vaccines. Also, the team and our community partners continue to work hard to ensure that everyone in our community who wants to get vaccinated gets vaccinated. So it's not just about having an opportunity to get vaccinated, rather it's about going the extra mile to make sure that those opportunities meet people's realities. As such, I do want to highlight my colleagues on this call, especially Molly and her team, for the incredible work they did behind the scenes last week to put together a viable and ambitious equity plan, which was submitted to Governor's office for their consideration in moving us to lower risk. And the best way to stay safe and keep others safe around us is through vaccinating. We do have currently 3 emergency use authorized vaccines, which are very safe and highly effective against hospitalization and even asymptomatic transmission. Pfizer vaccine is authorized for children 12 and above. That's a recent development, which is great news for our adolescents. These vaccines are widely available throughout the county, including at pharmacies and clinics. Walk-ins are also accommodated. So my plea to our committee members is to take 30 minutes, 1 hour out of their busy schedules and busy days and get vaccinated to protect themselves and their loved ones against this disease. Okay, I put this slide in after I send out the PDF, so you're not going to see it in your packet. My apologies for that, and that's because I regret I didn't raise this last week. On May 14th, 1796, so that's 225 years ago on May 14th, Edward Jenner, who is deemed as father of modern vaccinology, he was an English physician and scientist, applied fluid from cowpox blister to the arm of a child in the first part of an experiment that eventually proved mild cowpox infection protected against smallpox. And of course, we know the rest of the story with smallpox being eradicated. So this is the beginnings of our, frankly, not just vaccinology, but also public health efforts. This is where beginnings of public health started with having this tool in our hands to protect the public against this particular virus. So this next slide shows the number of new cases by week. This week, there are 462 reported cases, which is the second week in a row since we are seeing a decrease in our weekly numbers. It's almost an 11% decrease since the previous week, which is really fantastic news. Total numbers stand at 9,235, and unfortunately 76 deaths.
So Nahad, let me step in here. I think we discussed this yesterday a little bit. So we may see cases in some number for a long time. We may see cases. I mean, this is just a layman's view. But the number of deaths and hopefully hospitalizations will be going down because of vaccinations. So, maybe like the flu or, people, it's always circulating. That's possibly the world we're going to be in. So we will see cases in some number for a long time.
Yeah, thanks for that contribution, Commissioner. I think Mike is going to speak to the hospitalization a bit more later in the presentation. In terms of deaths, you're absolutely right. We should continue to see a drop in the death rates and number of deaths, since we are protecting, or we started rolling out vaccination by protecting those who are vulnerable, whether by age or underlying conditions. So that should be a phenomenon that we should be observing. Now, hospital admissions, I think Mike is going to have more information on that. Look forward to hearing from him.
Understood.
So Nahad, we just had 2 deaths. I think our report was 74 last week. So what was the age of the 2 deaths, and were they vaccinated?
Yes, Commissioner, thanks for that question. We do have 2 elderlies in their 70s and 80s who died on May 10th. And I believe they were at the St. Charles Medical System, where maybe Mike will have more information on that.
I think they were unvaccinated and both had underlying conditions.
But I think that those 2 deaths highlight, again, all 3 numbers that we're concerned about: total case numbers, hospitalizations, and deaths or severe COVID illness. Those, we will continue to see cases, hospitalizations, and potentially deaths in the unvaccinated population. And so, I would just expect that we're going to have numbers as high as, like the size of our numbers are going to be proportional to how many people are vaccinated. So if we've got 65% vaccinated at this point, and we're seeing certain numbers of cases and hospitalizations, the way to get those down is to get a higher percentage of our population vaccinated.
Yeah.
Which is the next slide.
Yes.
Yeah. I do think that's a very true statement. Certainly, we're going to have some breakthroughs, currently less than 1%, and that's probably an overestimate based on the definition. We know vaccines are not 100% effective, but they're certainly, 90+% against acquiring the virus or infection and against hospitalization. So we have a very safe and effective tool, which actually speaks to my next slide, as Commissioner DeBonne alluded. So despite this decrease, and I'm going to invite Emily also to chime in here, despite the increase in new cases, our case numbers still remain quite high. And I would venture to guess that it'll probably increase in coming weeks, given sort of what is transpiring in terms of the decisions for putting us back into low risk category and opening up the economy. It's just logical that there'll be some transmission there unless vaccination rates increase quite fast in the coming weeks. So frankly, the high case numbers still, they're nothing out of the ordinary. The reasons behind the transmission is nothing out of the ordinary. There's no voodoo or magic here. It's still cause and effect. It's our social behaviors. It's it's Johnny and Bobby hanging out after work, having a beer, not wearing masks, not being vaccinated, not testing. It's Jenny, Julie, Jack, and Allison carpooling after school activities, and again, not wearing masks and not being vaccinated, not testing. These are obviously made up names, but the point is real, and it's what our case investigators and contact tracers are coming across on a regular basis. So I'm going to pause for a minute and see if, Emily, you have anything that you'd like to share in terms of outbreaks or any patterns you're observing.
So yeah, thanks, Nahad. Like you said, it's really the same kind of things. We are seeing significant transmission in like the micro populations where people may be more vaccine hesitant or haven't yet had time to receive their vaccine. So like Nahad said, those smaller kind of group activities like carpooling and some of those, and also larger group activities like faith-based gatherings and potlucks, some of these larger things where people are removing their masks and the population is often not highly vaccinated, we're seeing a lot of transmission. Once the spark gets in there, it can spread very quickly. And then we have cases from that gathering itself, and then that moves on to people's family members and affects schools, and more cohorts are being affected in those different ways as well. So
thanks, Emily. So as I've said in the last few weeks, we get it. We're all humans. We all have our social, we have some certain social requirements and social needs. So if we want to socialize, if we want to go out to parties with people who may or may not be vaccinated, then really we should do those, we should engage in those activities in a safe manner. We should wear masks, we should socialize outdoors, and better yet, just vaccinate, because that removes some of the barriers and some of the requirements. And test yourself. If we should test ourselves. If we're suspicious that we've been around people who may or may not be vaccinated, somebody was maybe showing some symptoms or not, or just we're concerned, we can just go get tested. It's so easy these days to access tests, whether at home or at one of the providers. So that's my plea to our community members is you're going to socialize, you're going to gather, just do so in a safe manner. And in fact, if we are fully vaccinated, and I am fully vaccinated, by the way, and I'm exposed to someone who has COVID, then I don't have to quarantine as long as I don't have any symptoms, because there's always that risk of breakthrough, which is quite minimal. If we're not fully vaccinated,
if it's so highly asymptomatic, how can you be sure? I mean, didn't you originally tell us that COVID was 40% asymptomatic? Has that number changed?
Those are the figures we're coming across still, Commissioner. I'm not, maybe you could kindly repeat your question?
Okay, well, you were saying if you're vaccinated and you're around someone that is COVID positive, you don't have to worry about it unless you start getting symptoms. And yet again, aren't a lot of people up to 40% asymptomatic?
Yeah, so that dynamic is certainly, it is true, Commissioner, that we have asymptomatic cases, people who are transmitting the virus but not necessarily showing symptoms, which has been part of the challenge in responding to this pandemic. Being vaccinated, however, changes that dynamic and changes the transmission patterns in our communities. So we could still be in a setting where we're not sure if people are vaccinated or not, and they could be asymptomatic transmitters or silent transmitters. Yeah. And if we're not fully vaccinated and we're exposed to someone who has COVID, then currently the requirement is 14 days of quarantine. So certainly the incentives are lining up with being vaccinated and avoiding quarantine and disruptions to our lives. And again, back to testing, every Thursday this month, there are testing sites available, especially in Bend at the Wall Street Service Building. No ID required, no money, nothing. Just show up and get tested if you have symptoms or you're suspicious of anything. So no questions asked, just show up and get tested. Last week, we were able to identify 16 positives out of the 88 people who showed up for testing. That's quite a high positivity rate of nearly 20%. So that means those 16 people who were identified were advised not to not to expose others and quarantine and come out of the circulation so that this virus can be interrupted.
Nahad, a question about the testing events. Do we anticipate we'll be doing a testing event in the same location over here on Wall Street for next week or the next week, or will it be moving around?
Yeah, sorry to interrupt you. I think next week, Commissioner, we are anticipating that going into June. I don't know if, Emily, you have more info on that?
Yeah, we're definitely planning these events into June as long as we see the need and our community members are accessing this service. So we're working with OHA to make sure that we have the availability both in Bend, and then we're also working on planning a couple events in Redmond in the month of June as well.
Great. Thanks.
And it's not just that 16 people tested positive. This is really, it has a multiplier effect, right? There are close contacts, those affected around them. That's how suddenly it balloons up. Yeah, 16 people multiplied by 4, and then those 4 multiplied by other 4. I mean, I'm just throwing this figure out there just to demonstrate that it's not just 16 people. We're talking about potentially dozens and dozens more people who could be impacted by this. And again, there are still questions around allergies and COVID-19, and I'll spare you the differential symptomology here. I'll just say that if you're experiencing any symptoms, I think it's just safest to reach out to a provider and get tested, or show up to a Thursday free testing event and get tested, just to be on the sure side. This slide is our vaccination coverage by age group, and as you can kindly see, we're continuing to do quite well for age categories above 60. That's really remarkable. We still have a lot of work to do in the younger age groups, though certainly we're doing our best, and committee members and partners are doing their best to increase those numbers.
So we could talk about vaccination rates. So the 65% number was published recently for Deschutes County, which got us to this low level. And the difference is, and it was in the paper, and I don't know that it was exactly what I meant to say or whatever, but the VA numbers, the federal numbers came in from veterans that had been vaccinated through the VA, and then also federal allocations, and it ended up being printed in the paper yesterday as federally qualified health clinics, but I don't think that was the only place. It was just other federal allocations to businesses and pharmacies. But that's the difference between, because this was the discussion yesterday at the governor's office, the denominator and the numerator to get to 65%. We were publishing 63%, but magically we went to 65%, and it was really those federal numbers that helped us get to that number yesterday.
Yeah. Commissioner, thanks for bringing that up and mentioning also what was published in the paper. And maybe it would be helpful to mention that what probably I would have written in the paper is that 65% of the eligible population, so that's 16 and above, who have been vaccinated. If we look at the totality of our population and what we refer to as population immunity, we're probably around the 50% mark. So yes, we commend the efforts around 65% coverage, and yet we have some work to do with regards to our overall population immunity and protection.
Well, so that's a reminder that I could have been a little more precise about the words I was using during the interview, because that's how it gets published.
And looking at this slide and the one after it, I mean, the story basically, re-emphasizing the story, the highest numbers of cases are in the age brackets with the lowest levels of vaccination. So, again, if we have high case rates, it's because COVID is raging through the unvaccinated population of our community.
Yeah. Thank you for covering this slide, Commissioner. And as I think I may have mentioned this last week as well, that it's not really rocket science, right? All this virus wants to do is survive, right? And it does so by jumping from one susceptible person to another in this case, right? There's obviously the whole discussion around animal reservoir as well. And that's probably why it's going to be very difficult to eradicate this virus completely from our planet. But in terms of its instincts, it just wants to survive, and it does so from jumping one susceptible to another, which means that if we're not protected, whether through natural or immunity or through vaccination, then we are basically a target for this virus. It's that simple. And this next slide, Commissioner, is really it's showing our testing volume. It's one that we keep focusing on, testing and vaccinating, right? These are the safest ways for us to basically be able to continue to engage in social gatherings and whatever decisions we make. So let's just test to make sure we're not inadvertently positive and transmitting. So the volume is slightly down since last week, in fact, last week was also slightly down since the previous week. Our positivity rate is hovering around 9%, which is alarming. It's high. We want to be less than 5%, less than 3% would be even better. So this is something that we need to continue to keep an eye on. And again, I suggest we don't delay any testing. If we're around someone who tests positive, look at the range of time between 6 to 9 days and get tested, please.
Nahad, can you comment on, our testing, our number of tests and our test positivity rates are really, really interesting and important thing to track. Can you comment on whether it's getting harder to get people to come in to test, or whether it's taking a lot more effort on our part to make tests available to kind of maintain the level of testing that we're seeing in a community?
Yeah, I could, but in fact, I think Emily, it would be more powerful if it comes from Emily. Emily, maybe you could share your ground level experience in this regard.
Yeah, so I would just say I think it's certainly difficult. The test is there and it's available in our community in many, many different places. So if people want to access testing, you know, early in the pandemic, it was really difficult, and I would hear over and over from different people and businesses, if we could only just get testing and know if our employees were sick, if we could know if they've been exposed and were able to transmit it, it would be so helpful. And now we have that tool, right? This tool is, whether it's our free Thursday testing events, or, you know, you're going to a pharmacy and getting a free test, or going to your primary care doc, or, you know, urgent care. There are so many different places we can access testing. The difficulty is getting people to think that's important to test and understand the consequences of not testing, especially if they're, you know, very mildly symptomatic, or like we mentioned before, that kind of allergy thing. Just yesterday in a private kind of conversation, I heard someone mention, I was mildly symptomatic early in the week, and by the end of the weekend, I felt just horrible, got tested, and it was positive. But by that time, I had already exposed many people and family members that then had to quarantine and couldn't go to school for, you know, 14 days because of my exposure with them. So I really think it is important to, you know, let people know this access to testing that we had been asking for many months. We have it. And we really just want to encourage anybody who even has an inkling that they were exposed or just a little bit sick. You know, most COVID patients do not have a fever. I think it's only around 30% of people that report having a fever. And I can't tell you how often we hear, I didn't think it was COVID because I didn't have a fever. So any of those mild symptoms, I think it's really important to encourage testing and seek that out so you can protect other people. And protect people from, you know, those other consequences. You know, there's health consequences, but then there's also consequences of, I have to miss this event that I wanted to go to because I had a, you know, quarantine, or I can't play in a sporting thing, or, you know, the list goes on and on. So.
Thanks, Emily.
Thanks, Em. That was very helpful. Thank you, Emily. This particular slide on hospital admissions, if you allow me, I won't spend too much time on it because I think Mike is going to cover this much better than I will. I do know that Commissioner Adair is often curious about the ever hospitalized number. So I do have that number for you at 507. And that's really thanks to Mike. He's been a great partner in providing these details for us. So ever hospitalized for Deschutes County residents stands at 507. And I believe as of this morning, we've had 48 admissions in the hospital system. At least that's the information I received. And again, this is a tri-county indicator. 28 of the admissions are Deschutes County residents, 9 are in ICU, and 7 are in vents. And I believe Mike will have more information on this. Okay, so we did receive new guidance on those who are vaccinated and masks. It came from CDC. It was adapted by Oregon Health Authority. It was circulated, I think, yesterday afternoon to the local public health agencies and counties. I could just share what's on this slide, and then Emily can also chime in with sort of maybe the implications on businesses. So if yes, and I think this is a really easy diagram, helpful diagram. Yes, I'm fully vaccinated. So this is dichotomous. We're either fully vaccinated or we're not, right? So even if we're partially vaccinated, we fall under the not fully vaccinated. So either I'm fully vaccinated and I can go without my mask and I don't need to physically distance in businesses that are checking my vaccination status. So there is still a bit of responsibility on behalf of our employers and businesses and faith institutions to check or verify for vaccination if they choose to do so, because they can also continue with status quo. And then if I'm not fully vaccinated, I still need to wear my mask and physically distance in businesses that are checking vaccination status. And for both categories, I still need to wear my mask and I need to physically distance in businesses that are continuing to require a mask. Okay, so Emily did you want to, I'm sure this is challenging for our businesses, and I'm wondering if you have any thoughts on that.
Yeah, so we are getting lots of questions from businesses on how to handle this situation. And I think that the dichotomous nature for a business is the same, right? Like they can choose option A, which is status quo and requiring masks, or option B, which is to look at everyone's vaccination card or look at proof of vaccination for either their staff or their patrons that are coming in, and allow those people that are fully vaccinated to go ahead and remove their mask when they're there for whatever reason they're there. I would just think about being compassionate. We've put our businesses in a lot of really hard circumstances over the duration of this pandemic, and businesses have had to move from being just trying to do business to also being a regulatory agency for all the people that are coming through their doors. And it's really hard. We understand that it's really hard on businesses, and making these choices is difficult. And, so our community really needs to understand and respect whatever the business has chosen to do. We're also getting lots of questions from businesses on whether or not they're allowed to check for someone's vaccination status. And the answer is they are. So you can ask to look at someone's vaccine card, and they can choose not to share that information with you, right? Like that's a choice they can make. And if they make that choice not to share that information, then they can continue to wear a mask. That kind of is up to them. But, making this plan and deciding how you're going to do it is just another kind of step that the businesses are going to have to make. And they've had to make lots of plans and do lots of really hard things over this. And this is just another one. So I really would just ask people to really understand whatever the business chooses to do, please respect that kind of choice, because they're in a really hard situation as well as all the employees. It's not comfortable to start asking these new questions and doing these new things. And so, as we move into this, it's important to remember that.
Thanks, Emily. That's really helpful. And so I'll give the floor now to Molly. I want to also respect Molly's time and Mike's time as well. So Molly, go ahead, please.
Thanks, Nahad. So this is just our information on vaccinations in Deschutes County. So one thing I want to say about this is you'll notice that it says eligible population is at 63%. And that is based on information that OHA had posted on Monday. This does not include, as Commissioner DeBone stated, the federal doses. So OHA notified us yesterday that the federal doses did push us over above the 65%, and that is why we're looking at going to lower risk on Friday. So this shows us that currently of the eligible population, and here that's 16 plus 63, but we are over 65% fully, and then fully vaccinated, we have 52.9%. So I think it's important for the community to keep in mind that this eligible population and 65% that has made it possible for us to go to lower risk, that's just one shot in the series. So that's not fully vaccinated. And I wanted to remind everyone also, just in respect to everything that we've been discussing today, fully vaccinated is 2 weeks past your second shot or 2 weeks past your first with Johnson & Johnson. So we still have a lot of work to do to keep our community safe. I think that, of course, our businesses are happy that they're going to be able to open up more than they are currently. But in order for us to continue to decrease spread, we need to continue to vaccinate. We wouldn't want our businesses to get to the point where they had to close because they have an outbreak and many of their staff are out. So the best way is to vaccinate, continue to mask, and to test if you have been exposed or if you're experiencing any sort of symptoms. So as we discussed earlier, we were notified yesterday that we will be reopening at least to lower risk on Friday, and that is because of passing the 65% of residents 16 and older. In terms of residents, all of our population, we really are only at about that 50% rate. So we want to continue our work on getting vaccinated. The other thing that led to us reopening is our submission of the equity plan that was submitted and approved. So we will be continuing to do a lot of work around decreasing the gap of equity in vaccines for racial and ethnic gaps, or for vulnerable individuals, and then also for our frontline workers out in the community. Go ahead, Nahad. So this is just one of those ways for us to get vaccinations. You can continue to go to our Central Oregon COVIDvaccine.com, and there's links to all of the different providers who currently have vaccines and who will be giving out vaccines. St. Charles and Mosaic will be providing vaccines for their patients, as well as people who are not patients. And then, of course, we have urgent cares out there, and we have pharmacies. And then the county facilities, our public health agencies, will be doing pop-up clinics throughout our community as well. I need to just, one sec. Okay. So good news in terms of our vaccinations is that, we are approved now to go to 12 plus for our Pfizer vaccine, and there are numerous options at this point for our students 12 and older to become vaccinated. For instance, Mosaic is doing clinics now Monday, Wednesdays, and Fridays from 8:30 to 11 a.m. and then also from 1 to 2. Those are walk-in clinics, so you can take your family down there and get vaccinated. There are multiple school clinics that are going on in collaboration with Mosaic and COPA and Summit, I believe, as well as public health. If you're interested in attending any of those clinics or the Mosaic clinics or clinics through COPA, you can go to the Ben Lapine School District website and find links there and find all the different dates on that website. You also should be able to go to Central Oregon COVIDvaccine.com later today and find that information there as well. And then just a reminder that we are wrapping up our mass vaccination clinic. So we are now just doing our second doses at the mass vaccination clinic. However, we are also providing walk-in second doses. So if you are waiting to get your second dose and you don't have an appointment, feel free to come into our clinic during these times. Make sure you bring your card, especially if you weren't vaccinated at the clinic, so that we can verify that it's your time to get your second dose vaccine. If you don't have your card and you were vaccinated at our clinic, we can look that up in our system for you. And then just a reminder, for Pfizer, you need to be 21 days out from your first dose. And for Moderna, you need to be 28 days out from your first dose in order to get your second dose. And just a reminder, you don't need ID. This is free. You don't have to have insurance. So just come on in and get your second dose if you need it. We are partnering with frontline businesses to try to get to our frontline workers who haven't been able to get vaccine. So if there are businesses that are interested in doing this, they can email healthservices@deschutes.org. I will say that we've had a lot of interest, which is great news. We're excited to see that our businesses are wanting to help get their staff vaccinated. Because of the overwhelming response, we will be working with businesses to try to either combine different businesses to get the vaccines, or example, we're working with the library in downtown Bend currently to set up a weekly clinic down there that's obviously in an area where people can walk to the clinic or to the library and get vaccines. Those will be walk-ins, first doses and second doses. So we should be identifying what day of the week that will be starting next week and get that information out to you. Also a reminder just to businesses, if they have the ability to incentivize employees, that we found that to be helpful as well. And just if everyone can share the information about getting vaccines and all these different easy ways to access vaccine, that would be great. If you have questions, you certainly can go to our website listed there. We also have our email assistance. You can send questions to that email and someone will respond to you. Or you can call our COVID vaccine hotline at 541-699-5109. That's all I have.
Thanks, Molly. Before giving the floor to Mike, I do want to share something with our community members. Even though I'm fully vaccinated, I don't have any underlying conditions. Depending on how things transpire in our county, I will for some time probably continue to wear masks. And there might be others too who may choose to do the same. I think it's important to keep in mind that if someone's wearing a mask, it doesn't mean that they're one or the other, vaccinated or unvaccinated. I think it's important that we remain compassionate and we don't judge anyone. It doesn't fit the values of our county and our community members, in my view. So with that, I'll give the floor to Mike if commissioners agree.
Yes, thank you so much. Thank you for joining us, Michael.
Yes, good morning, everyone, and thanks for allowing me to share some information with you this morning. I put together a few slides, and actually I pulled together a couple of numbers and a couple of things to address some of the comments and questions that have already occurred today. There was a lot of talk about the deaths that have occurred. Yes, 2 recently, but there have been 10 deaths in St. Charles in this month. The average age of those patients was 75 years old, which is about the same as it's been since the beginning of the pandemic for mortalities. On average, these 10 individuals had 1.6 comorbidities. 2 had no comorbidities, and I should note that 1.6 comorbidities is equal to the average for somebody of this age. So it's not like they were super sick. They were average for their age group. 2 of those patients were actually under 60 years old, 6 of them from Deschutes County. And I don't like having to say this, but we're already tied for being the 3rd worst month for mortalities. And it's, what is it, the 19th? And we could very well have the 2nd worst month behind, I don't know, December and January. We're approaching those quickly. So there was also some talk about breakthrough cases. So a breakthrough case is someone who is fully vaccinated. And so I take a look at the hospitalized breakthrough cases. We have had 8 of those since March 1st, average age 76 years old. We did recently have 1 death of a breakthrough case. But I think what's really important is we can say, since March 1st, 97% of our hospitalized patients have not been fully vaccinated. So it's worth noting. So anything before I move on to the slides I had prepared for today?
Looks like nothing, but thank you.
Here's our predictive model. And the only thing I really want to highlight here is this chart that's up above. This looks like it's a steep curve downward, but 3 weeks from now, the model is still saying that we're going to have, around 40 patients, anywhere from, 30 to 40 patients in the hospital 3 weeks from now. So it does look like a steep curve, but that's because we're looking at 15 months of the pandemic. So I guess if I should start by saying that there's really 2 messages that I want to deliver today. Number one, and it's kind of what you've been hearing thus far, is we are not out of the woods yet. And secondly, I'd like to highlight that the patients in our hospitals this month don't look exactly like they did in the months past, and they're not having the same kind of experience. And I'll go into that in more detail. Here's one of those details. This chart showing the decreasing age of somebody who's going to the ED and presenting with COVID-19. And it has been on a steady decline since December. There is and so dropping over that period of time by about 10 years on average. It's jumping around a little bit for the average age of somebody being admitted to the hospital, but you can see quite a jump there at the beginning of March when the vaccinations started to kick in. And so when we were vaccinating the older population, those who were unvaccinated were the ones that were showing up more frequently, and we've been seeing that. And because they are, there's an odd thing going on. Yes, we have younger patients in the hospital on average, and typically younger patients spend less time in the hospital, and that's what we're seeing. Here's the average length of stay in days over the past several months, and it's about less than half of what it was 4 months ago. So yes, it is on the decline, and that's a good thing for the patients. But here's the deal: the volume of patients in the hospital remains high, and their length of stay is going down. So what that means is we have a very fast revolving door. There is a lot of turnover that's happening every day. We've had days where we have discharged as many as 15 COVID patients in one day. That takes a huge toll on our staff and our resources to turn those beds over and to admit and to discharge all those patients. So, I mean, that's really taxing our resources. There's another thing happening that's a higher proportion, and that's why I said it's a weird thing. They're having a shorter length of stay overall, but we still have some of those older patients typically within that group, and there's a lot of people in the ICU. A higher proportion of those in the hospital are in the ICU. So the volume remains high, the turnover is high, the ICU rate is high. You can see on this next chart, the ventilator use is high as it's ever been. So I guess this is, back to my main theme is, we are not out of the woods yet, and we are dealing with some new characteristics of the virus. Here's another reason why I say we're not out of the woods. This is a cumulative count. Now, this is for all of Central Oregon, not just Deschutes County, but you can see that we've had, well over 12,000 cases thus far, and that is a steep climbing curve. Here it is shown in a slightly different way, similar to what Nahad showed earlier. And fingers crossed, we may be on a downward slope now. This is a moving 7-day period of cumulative cases. And we were above 600 cases for a couple of weeks. And now it's starting to come down. We've had 4 days in a row with less than 100 cases in Central Oregon. That's happened before, but hopefully this time it'll stick a little bit longer. This next slide I borrowed from Dr. Peter Graven at OHSU, and it's actually a week old, but, and I know that this is an eye test, but that one yellow line that is skyrocketing is the number of hospital cases per 100,000. And we are the only region in the state that is going crazy like that. Everybody else is flattening out or decreasing. And Region 2, which is the vast majority of that population is right here in Deschutes County, is greatly on the rise. I think we are just starting to see that flatten, but I can't explain why Central Oregon is not behaving like the rest of the state. And I don't know, what some people are thinking is, oh, all we do is say we have a bunch of people that are coming to Central Oregon. Yes, we do, but the people in our hospitals are Central Oregonians. They're from our 3 counties, almost exclusively. There are a couple that are outside our county. What I see, 49 out of the 55 yesterday were from our 3 counties, and all but 1 were from counties within our region. So, just a few summary comments. Our hospitalizations remain high, and they probably will for a couple of weeks. And we are hoping to see that decrease. but it's not going to happen as quickly as any of us would like to see. We are starting to see a little decline in the number of positive cases. Fingers crossed that's going to continue. I will say, as glad as I am as everybody else, that we are going to enter a new risk level, at the end of this week. That's going to challenge us. And we need to, there's a direct correlation with our behaviors and what we're seeing happening in our hospital systems. So if you're not vaccinated, take that responsibility to either get vaccinated or to behave accordingly. Even if you are vaccinated, follow the rules and be a good example. All right, I'll get off my soapbox there. So I think it is important to note that we did see the positivity case that Nahad talked about. It's higher in Deschutes than it is in the other two counties, but 2 out of 3 of those counties are still, of our counties, are still over 5%, and Crook County is just barely below 5%. We still have over 100,000 people that in my predictive model fall into that susceptible population. So they can still get the virus. They can still transmit the virus. Many of those, as was mentioned earlier, may be completely asymptomatic. So again, all those bullets are aimed at, we're not out of the woods yet. And as I mentioned before, just in recap, we got a younger age group that are showing up in the hospital, some of them very sick, and many patients ending up in the ICU and on ventilators. So from the hospital perspective, our resources are really being strained because of these continued high numbers, burnout from the staff, and just the severity of those who are in the hospital. So happy to answer any questions. Otherwise, I'll just turn it back over to Nahad.
Can I ask a question about that term susceptible? I guess how do you construct that number? Is that just people who haven't been vaccinated yet, or people whose behaviors make them more likely to get COVID, or what goes into that term?
Thank you for asking that. We have what we call a compartmentalized model. So you fall into, and I'll simplify it, one of 3 buckets. You're either susceptible, you're infected, or you're removed. So if you have not been vaccinated, nor have you gotten the virus, you're in that susceptible pool. You're infected if you're currently dealing with the virus, and you're removed if one of 3 things happens. You've either had the virus, you have passed away, or you are vaccinated. So you fall into one of those 3 buckets. So if you're sitting over here in this susceptible pool, you still have potential to be in that infected pool. But as we're saying like a broken record today, you can also choose to go directly to the removed pool by getting vaccinated. And so that's how all of those, the dynamics of that model works. It's really quite simple. It gets more complicated when you start talking about vaccination rates and efficiency of the vaccine and transmissibility and variants and things, but that's it in a nutshell.
Great, thank you.
I would like to say therapeutics, if you're younger and you have some symptoms, please get a hold of your doctor so that you don't end up in St. Charles. There are clearly therapeutics that do treat COVID depending on your symptoms, and you need to talk to a doctor. Don't wait too long. I see the numbers from other states, and I'm wondering why ours are so high, and they clearly are high for the state. We've been at the top of the charts lately, and that is definitely not the chart you want to be on. But if you have, get your therapeutics. There's some wonderful drugs out there, and you need to use them if you are, not asymptomatic. So thank you.
Thank you, Dr. Johnson, for sharing that with us today. Very good information, and really grounds us and puts us back in the reality of we are not out of this pandemic yet.
Thank you very much.
Okay, anything else, Nahad?
Well, thank you, Mike, for the sobering presentation that was. My takeaway, although certainly the numbers you shared, the characteristics of those who are admitted, everything that you shared is quite alarming. My takeaway is that, this event of the pandemic was not something we could control, but the quality of the outcome, which is not the same as the events, really depends on the quality of our response. And we have some control over what happens with this virus. And I think the easiest path forward towards individual freedoms and opening of our economy is through vaccination. Now, there are other means too. We can continue to wear masks, we can continue to test, and we should continue to do those things as well. I think the path of least resistance is really through vaccination, especially when they're so effective and safe based on the trials and hundreds of millions of doses being administered. So it's a risk-benefit analysis that we need to consider. And for me, it's been a choice to get vaccinated. My kiddos will get vaccinated. I will, for some time, wear the mask, and because I just feel more comfortable. It's a bit awkward for me not to, but I also look forward to a day where I will get rid of the mask. Thank you.
Great, thank you so much. Great update today. So let's talk about the frequency of these updates. Remember, the concept is we may be stepping to every other week. It could be out there. We do have a budget week 2 weeks from now also. So then would we want an update next week and then possibly go to every other week? So this is a discussion for the board. And
that seems to make perfect sense because we are going to have that whole week budget. So we know that one's going to be a no update.
So next week would be an update.
And then start going every other.
And then possibly every other week. I don't know.
Possibly every other week. I mean, if we continue to be the worst in the state in terms of case numbers, we might want to continue to dedicate more focused attention to this, to try and figure out if there's anything else we can be doing to address that. But certainly the next 2 weeks during budget week, I don't know how we would fit a COVID presentation in if we wanted to.
Yep. Okay, so we'll go with that. Next week we'll see you again. Thank you so much. Budget week after that, and then we will go from there.
And I want to repeat therapeutics, folks. Vitamin D, ivermectin. There are a whole bunch of therapeutics out there, and it sounds like people need to be taking some.
So
apparently Americans are vitamin D deficient because we all wear sunscreen and we cover up and everything. So, and the sun is, well, it normally is out
right
there.
now. Yep.
No, I don't see any sun right now.
So we do have a little bit of financial discussion, if we can fit that in before an 11 o'clock public hearing that was published on our agenda. I would like to do that and touch base with Greg Munn. And as I say, if this is a longer discussion, we can also bring it up again later. So thank you, everyone.
Thank you.
Thank you for joining us.
Good morning, Commissioners. I realize we're on a tight time frame here. I just had a couple of quick updates that I wanted to share with you. For the record, Greg Munn, County CFO. Two things real quick. One is on ARPA, American Rescue Plan Act, and the other one's on the FEMA Mass Vaccine Center grant. So I gave you an update on, or we started talking about, it was an introductory conversation on May 5th about, how do we set the groundwork for distributing the ARPA funds, $38 million soon to be received. So just since that date, we submitted our application to the U.S. Treasury on May 18th. So that was actually yesterday. And according to what I've noticed from other counties who've submitted, it takes about 9 days to 9 actual calendar days to receive those funds. So I'm expecting we'll see our first tranche of $19 million by the 26th, next Wednesday. So just a short update there.
Thank you.
And then, in addition to that, following the direction from the review with the board there on May 5th, we are developing a structural priority framework that we'll bring back to you for further discussion and take that next step. And that'll be coming soon. And additionally, we are having some conversations with our regional partners and really to have some initial exploration if there's some overlaps that exist and in priorities and where potential partnerships might make some sense to look at in terms of future partnerships on some of these projects. So that's what's going on there. Just want to give you a quick update. And then also on the FEMA OHA grant, or I should say the OHA grant of FEMA funds, we received it yesterday. We have a couple of questions we have out to OHA for clarification purposes, and we will bring that back to you as soon as possible.
Okay.
Short and sweet. Any questions?
No, good information.
Thanks so much for all your work, managing these extraordinary year funding programs, Greg.
Yeah, you bet. Pleasure. Okay, thank you.
Thank you.
Yeah, just think of the inflation that we're creating. What it was at 4.2 or something. I mean, there's been inflation forever. Things have been getting smaller that you go and you buy. I find it fascinating, but we're definitely, inflation is taking off.
You mean when you buy a 50-pound bag of feed, all of a sudden it's 40 pounds magically?
No, they changed the size on it. I mean, we used to buy a pound of coffee and then everybody went to 12 ounces, but the price really didn't drop.
I know, that's what I've seen a few times.
Yeah, I think of like paper towels that they just kept getting smaller and smaller. And if you had an old one and you went, oh my gosh. So no, I've been seeing inflation for a long time, but it's really ramping up now. You see all the building costs, what they've gone up 20, 30% since January. Unbelievable.
Okay, thank you very much. Next item is a public hearing in consideration of approval and adoption of Ordinance 2021-006. Dave Doyle.
Yes, Commissioners, thank you. I believe Cody Smith from Road and Captain Garrison from the Sheriff's Office are going to be joining us by Zoom. This is the time you've set for a public hearing. You might recall last year the board adopted and enacted Section 9.20 of the Deschutes County Code dealing with jumping off of county bridges and prohibiting that. At that time, it was limited to a single bridge, Harper Bridge, and it had a sunset clause in it. And so staff would like the board to consider, this is the time noticed appropriately for a public hearing, removing the sunset, reenacting that provision of county code and expanding it to cover all county bridges and not just Harper Bridge. So unless you'd like a staff report from either Cody or Captain Garrison, this would be the time to open the meeting and call for any testimony that might be out there.
So I would like to open the public hearing, and I will open the public hearing on this matter regarding jumping off of county bridges. So having a public hearing open on the matter, we have no one in the room joining us on this topic, and it was published for 11 a.m. and it's 11:07. Is there anyone on Zoom other than our staff that is participating, requesting to speak with a raised hand feature? It looks like we do have a phone number. I would assume that's Captain Garrison, possibly. Looks like a county number.
Yes, Commissioner, that is me. I'm here. So if you have any questions that you would like me to clarify in regards to that topic or information, please just ask, and
Great.
I'll attempt to answer that.
Yes, thank you so much. So seeing no participation in this public hearing, I will close the public hearing on this matter. So we have provided that opportunity. And at this point, any questions or requests by the commissioners? And we can get a staff report on this also.
Yeah. I mean, one real specific question I have that maybe Cody could answer is if this ordinance is adopted, what will we do in terms of posting notification about about that regulation at bridges? And again, my concern is if there's a bridge where people aren't jumping off right now, but you put up a sign that says don't jump off this bridge, it actually might put the idea in people's heads that hadn't even thought of it before.
Hey, maybe that'd be fun.
I mean, clearly at Harper Bridge we need signage, but are we going to go and put signage up at a lot of other places, or are we going to wait until it becomes a nuisance before we would do that?
Yeah, certainly speak to that. And again, for the record, Cody Smith, County Engineer, Deschutes County Road Department. So, just backing up here a little bit again, the immediate concern at hand is the issues with folks congregating and jumping off of Harper Bridge in the midst of all the other challenges we've had in recent years there at Harper Bridge. So the concern from Road Department staff is in the thought of adopting an ordinance to prohibit jumping off of Harper Bridge. There's kind of somewhat of a implicit consent there that jumping off of all the other bridges, say for Harper Bridge, is allowable or is appropriate. And so from Road Department staff perspective, we don't want to see that. In the end, our county bridges are not playgrounds. They're not diving boards. They're strictly for the intent of carrying our public road over and across a waterway, a railroad, or some other topography that requires a bridge to carry that road. So in terms of if this ordinance is adopted, the Road Department does not intend to go out and put postings at every bridge. Our intent is only presently to put a posting at Harper Bridge. And I think, with that, I think after I'm done talking here, it'd probably be good for Captain Garrison to talk about this from an enforcement standpoint. But, we are aware that we have from time to time issues with folks jumping off of other bridges. I mean, just anecdotally within the Road Department, we've observed people jumping off of the Deschutes River crossing on Tumalo Road with the Deschutes River Bridge crossing for Obie Riley Road as well. In total, we have 8 Deschutes River crossing bridges that are under county jurisdiction. We have another 6 bridges that are under county jurisdiction that cross the Little Deschutes River. As far as the actual condition, the channel conditions underneath those bridges, I mean, I'm not really ready to speak to that, but in general, we don't want people jumping off of any of our bridges. So, having this ordinance in place it's not going to lead to the Road Department going out and putting a posting at every bridge. We're at this time, we're only going to be putting postings at Harper Bridge. But with that, I mean, as other issues arise, and we're seeing other issues arise at these other river crossing areas where we have more and more people congregating to recreate, because it's providing a good access to get to the river, where other federal recreation areas are filling up fast, and new opportunities aren't new recreational facilities on the National Forest or on BLM aren't popping up left and right to keep up with the growing recreation demand. This ordinance will give us a tool to be able to quickly react to those things. So that if we do have issues popping up at other areas, we can start talking to the sheriff's office about posting and enforcement at those areas as well, without having to circle back to this ordinance every time.
Great. Thank you. Yeah, once it's happening and people are already, at some of these other locations, engaging in this behavior, like definitely, I think public notices on those bridges are a great thing. But just wanted to make sure that we're not giving people an idea if they didn't already have it. Thank you.
Well, I mentioned this earlier when we were discussing this issue, and I actually met a mom whose oldest son had jumped off the San Am and he died. So when you hear that, and that was in 1998, so of course her life has never been the same, but listening to that story, I realized that we don't need some youth jumping off. I know last year it was really bad. They were jumping off right next to their dad, and it was posted. So I just feel like Harper Bridge we've definitely got to protect, and there's a problem elsewhere. It would be nice to know that we've already taken care of our side of the story.
So I'm still in a spot where, this is a public hearing on the matter. I haven't had anybody come to me and say, man, we need to do this. If there's a justification by staff and legal that this is a liability issue that's implied by having bridges, maybe that's the justification, but I still struggle with the reason for even doing this.
I know, but isn't it interesting though that I met someone who actually lost her son that way? And so, as you just, when you hear the heartbreak in her voice from over 20 years ago, you realize that it was awful. I don't know. I think Captain Garrison could perhaps address some of the safety issues. I know that, didn't they have to give some people tickets or something last year because they were just jumping in and, and it said not to.
So, Captain, if you're available. Thank you.
I can't speak to that. We did, after the board put that into place last year, we did issue some tickets. It just gives us, as Cody mentioned, it gives us a tool that we don't currently have. It gives us a violation, a lower level enforcement tool rather than jumping to a crime, which when we start talking about that, we may be faced with disorderly conduct due to the system that's currently, that would be in place if we didn't have this. And it's not just simply the jumping off the bridge that's the issue. It's the congregating. It's the traffic hazard it creates. And then we go into the fact that, just like Commissioner Adair mentioned, is in the event someone was to dive off, become injured, then we have an entirely other arm of the sheriff's office that's probably involved in that, which is our search and rescue, which is to recover that person, whether they're injured or worse. And so if we can kind of preemptively be enforcing this before it becomes problematic, it's probably to the benefit of the county and the community as a whole.
Thank you very much. Dave, can you help me with this a little bit as a sitting committee?
Well, certainly, on a legal, I got to be somewhat careful what I talk about because typically we have legal discussions in executive session, but certainly that Pandora's box has been opened, and it was last year when the initial text, when the initial code was adopted. So to limit it to a single bridge certainly implies to a certain extent, and at least a plaintiff lawyer I would expect would argue that if his or her client was injured at some other bridge, that in precluding it at Bridge X but not saying anything about any of the other bridges, you've condoned it elsewhere. You've implicitly said it's okay to jump off there. And more, entities, government, business is responsible for maybe some bad decisions that other people make under the laws that have evolved here. So I see there's a real danger in limiting this to a single bridge. That was something the board chose to do last year, kind of ad hoc. The staff's recommendation a year ago was that it applied to all bridges as well, and it hasn't changed since then.
Yeah. Well, so as I say,
I just applied to all bridges.
There's no public participation in this process, I guess, is
Well, this was duly noticed. It was noticed in the paper, and so. Sometimes I think you can interpret the fact that no one's participating with is no one has an objection to what you're doing. And if they did, they'd be here in the room or they'd be on the Zoom. You know, the fact that people aren't here.
Well, and
doesn't
nobody's asked for
necessarily
it
mean-
either, so that's why I'm kind of stuck if, you know.
Well,
Nobody's asked me for it, yeah.
well, but who's going to ask for it? I mean, the people that are at ground zero, the sheriff's office and the road, are the ones asking for it.
Actually, there was a, maybe not asking you, but I remember last year I heard from one of the residents down in driving that road, and oh my gosh, and I received so many emails from she and her husband. They were so worried because they were seeing it happen, you know, fairly routinely when they were driving through, and they were just like, oh my gosh, somebody's going to get really hurt. So I did hear from somebody last year, and then I met the woman this year who lost her son from it. So, yeah.
Well, and I've been a resident of southern Deschutes County. I know the bridges. There's multiple bridges that I cross, Little Deschutes and the Deschutes. And as a sitting commissioner, I've been involved in this issue intimately for many years now. And this topic has never come up to me, you know, other than at this meeting, you know, it came up, maybe you brought it last year, and it says, okay, we had a really critical rush of activity at that bridge. And I mentioned at that time that this is a topic I don't understand, and then I had supported that we put it in temporarily and let it expire. So I'm just letting you know, I'm kind of stuck in that same spot unless there's a reason.
I guess I would just say that, you know, living in the city of Bend, I have witnessed this behavior not on county bridges, but on bridges within the city of Bend on multiple occasions. And whenever it's going on, there's always people standing around watching and saying, like, that is really dangerous. I hope that guy doesn't break his spine. And so, like, I am definitely aware that in our region, you know, on the Deschutes River, this is a risk. And in the same way that we've seen certain recreational behaviors spread out from the urban center, you know, basically, you know, tubing, you know, people like, you know, getting their floaty thing and putting it on the river, you know, in that chunk within the city of Bend and floating down through the center of the city. That is spreading to the other parts of, you know, of the county. And so, you know, if you think of that as an example, you know, okay, people started, you know, using their floaties on the river within the city of Bend, then they're doing it in other parts. People are jumping off of bridges within the city of Bend. Are they going to start doing that in other parts of the county? I mean, I definitely see value in being preemptive about this and kind of heading it off at the pass before it becomes a problem. But that's also why I had that concern about, like, let's not put the notice up on the bridge until we see people doing it, because we don't want to give people ideas. So I believe that there are constituents who are concerned about people jumping off of bridges into the Deschutes River in our community.
Well, great discussion. This has been a public hearing on the matter. We have great input from our departments and staff on this. So, yeah, is there a motion for this topic?
Also, I move that we approve ordinance number 2021-006. And do I need to say not by emergency? Because if you don't vote for it, do I need to clarify that?
Right, that's correct. If it's 2-1, then it would be the typical 90-day implementation window.
Okay, so then 90 days, when does that put us out there? Like September 6th?
Middle of August.
Okay. Okay.
The hottest part of the summer.
Well, we can only hope, right?
Right after the big rainstorms.
It was raining this morning on the way to town.
Sure would be useful to have it in July, too.
I did leave blank in the emergency section to take effect on date, so I didn't assume that it would be immediate. If you wanted to put a 30 or 60-day window out there to provide an opportunity for notification, for road to get the signage, for the sheriff's office to you know, gear up for enforcing it, that would provide that additional time. And if you were all in agreement on what that timeline could be, then you could adopt it by emergency.
Well, and as the captain mentioned, you know, having that lower level enforcement tool is a justification. And I'm just still hesitant to support it just because of the a lack of community input on this subject, and my long-term, experience with these bridge crossings. I just haven't seen concern. And obviously somebody could say, oh, yes, I'm concerned because if somebody got hurt, but that's a second step of a process. It's not direct.
I mean, people have died in the Deschutes River around the city of Bend fooling around. I mean,
Yes, didn't somebody drown not that long ago?
I mean,
he had like 4 kids or something. I mean, it was a really sad story, so.
Rivers are really dangerous. Can I ask an operational, like a pragmatic question? Cody and Captain Garrison, is the sign currently up at the bridge?
No.
No, it's not.
Okay.
The sign that was put up last summer was referencing an ordinance that had a sunset date, whatever that date was, the end of September. I don't remember off the top of my head, but so, no, it came down.
Yeah, so I'm not supportive.
I have a sort of a mechanical question, I guess, for Dave. Could there be 2 ordinances? One that just applies to Harper Bridge that could take effect immediately under emergency, and in addition to the existing ordinance that we're looking at that would take effect 90 days for all bridges?
We could do that, yeah, certainly. If they wanted to parse it out that way, that would be within the scope of what's been noticed and brought forward here today. So certainly that would be allowable if they were inclined to do that.
And I mean, once again, Harper Bridge, I've been through it many times with many phone calls, and it's just never been a topic. I mean, this is to say, it's just secondhand information from my point of view.
Well, then, in light of that, if the board is going to proceed, then your motion would just be to adopt that ordinance number, I forget the number here.
21-006.
Yeah, and to remove the emergency clause and have the standard adoption language.
Okay, and to remove the emergency clause.
So is that a first motion that I can second now, or
Maybe you could restate it, because we got a little.
Yes, I move we adopt ordinance number 2021-006, amending sections of DCC 9.20 on a regular basis? Do I say that?
With regular adoption, but no
Regular-
emergency clause.
With no emergency clause.
I'll second.
Okay, thank you. And is there any other discussion? Seeing none, Commissioner Adair?
Yes.
Commissioner Chang?
Yes.
And chair votes no.
Thank you. I'll get
yeah.
that ordinance cleaned up for your signatures.
Great, thank you.
Thank you, Dave.
Okay, and so we've been able to do item number 9 previously. At this time, the last item before recess would be at item number 10, consideration of board signature of document with Iris Telehealth. We have Chandra Mola on here as somebody joining us. Thank you very much. Audio. We could see you speaking. There we go.
That helps. And good morning, commissioners. My name is Chandra Mola, and I am the Behavioral Health Medical Team Supervisor with County Health Services. And I am requesting consideration of signature for our Iris Telehealth contract renewal, number 2021-255. Iris Telehealth is currently providing the vast majority of telepsychiatry services to our adult outpatient, child and family teams at our Courtney Clinic, as well as the majority of services at our South County Hub. We currently have 2 psychiatric nurse practitioners under this contract that provide approximately 72 hours a week of services for both children and adults. And I'm happy to answer any questions you may have about this contract.
Well, just acknowledging, yeah, it's quite a stack of paper, but it's very much a contract for services we're doing now, and it's great to be able to have these psychiatric services. I know that bringing on the next psychiatrist or having these capacities is very important.
Absolutely.
I guess my question about this suite of services is, how has it changed in the era of COVID, and kind of do you after COVID is over, like what do you see for telemedicine moving forward, and because my impression is that telemedicine has been like very valuable during the pandemic, and we've discovered that there's like certain people in certain places who it's just a lot easier to serve long term that way as well.
Honestly, this particular contract has been in place for several years, and COVID didn't really change how we utilize this. I think telepsychiatry is likely always going to be part of our the services that we provide. We've really depended on the telepsych services to cover some vacancies that we've had kind of long term in our psychiatrist staff. The preference will always be for in-person services, and yet I think the pandemic has definitely taught us that there is a use of telepsychiatry, to provide follow-up calls. But and again, this contract really is just covering us for some vacancies in our in-person staffing.
That's helpful to understand. Thank you.
So without any other discussion, is there a motion?
I move that we approve board signature on document number 2021-255, Iris Telehealth.
I'll second it.
Okay, any other discussion? Seeing none, Commissioner.
Could I just say something?
Yes, please do.
I'm so glad that you actually said that there is a preference for in-person. Honestly and truly, I do believe that. I think we deal with Zoom calls like on an hourly basis practically, and I feel that there's a lot that's missing. So thank you for saying that. I appreciate that. Sorry.
Oh, not a problem. That's the reason. So calling for the vote, Commissioner Chang?
Yes.
Commissioner Adair?
Yes.
And Chair votes yes. Thank you so much.
Thank you.
Also, just really helpful to understand that it's in part because we have certain chronic vacancies that we need these services. So, thank you.
Absolutely.
So at this time, we'll take a lunch recess, reconvene at 1 o'clock for item number 11. Okay. Okay. So this is our afternoon session for Wednesday, May 19th. Next item on the agenda is Deschutes County District Attorney Office Operations Analysis Overview. John, thank you for joining us today.
Thank you.
We also have a couple members of our Budget Committee, because this is one of those tasks we put in place years ago, talking about how to get some independent third-party analysis. So thank you very much for everybody following through with this. Yeah, Kathleen, you want to start us off here?
Sure. So I think you did a great introduction. Kathleen Hinman, HR Director, for the record. And, it's true. It's actually been, a couple of years now that the Budget Committee is, in connection with the board, supported going out and looking for a consultant to do the operations analysis in the district attorney's office. And so that's what we have the results here today. And we also have the consultant who completed the report presenting for about 30 minutes on the report itself. That's really all
Great.
I have.
And I'm hoping we have our consultant, Chris Heyman, with us. I don't see her on the screen yet.
I have a question. Did she ever come here?
No, she did not.
Commissioners, if I could just add
there's
just a word or two for context. And after speaking to each of you, as Kathleen said, just to kind of echo that, this is an important piece of constructing the FY22 budget. It's something we've talked about a lot the last couple of years. So we decided to not try and cram this into budget hearings, which is in a couple weeks. We have an hour scheduled for the district attorney's budget presentation plus Q&A. So felt it prudent to have an advance session discussion where John and the consultant can present the report and give you an opportunity to ask questions, and then consider any other questions you might have in the next 2 weeks between now and the budget hearing, that we can, so that we're efficient in our deliberations and discussions during budget week. So we're not expecting any decisions from you all today or from the budget committee. It's purely for information and to get a good handle on the findings and recommendations within the report in preparation for decisions in a couple weeks.
Thank you very much. And as I say, the District Attorney John Hummel is here, part of this process with us. So this is that opportunity for us to just kind of lay it all out and understand what a third-party consultant has given us some feedback. Any thoughts?
Well, great. Thanks. I have my management team's with me today. They're just going to have their cameras off. We won't be making a presentation. Yep. This is an opportunity for the consultant to provide an overview of her methodology and her recommendations. I won't be making an ask today for any budget positions. I think that's for the budget hearings. But if you have questions, I'm happy to answer that. So Chris is with us. She's with the Prosecutor Center for Excellence. She was a career prosecutor. Perhaps the capstone of her career was serving as a visiting fellow at the U.S. Department of Justice. And in that fellowship, she worked on developing best practices for prosecutors. Chris performed the assessment with John Gould, a professor of criminology at Arizona State University. I was pleased with the quality of their work. They put in the time, and I definitely want to thank my staff who were there to answer all questions and provide all the data asked for by Chris and John. And so, Chris, I'll hand it over to you, and you can have the floor.
Well, thank you very much. Thank you for inviting me into your meeting. As John said, I'm Christine Hammond. I am actually speaking to you from New York. These trees out here are just 1 hour north of New York City. I was a prosecutor in the Manhattan DA's office and now run Prosecutor Center for Excellence. If you go on our website, we do many things. But my specialty has been best practices for prosecutors, and we do assessments for prosecutor offices. To lay a little bit of a foundation, I heard one of the commissioners ask if we had come out to Deschutes County, and we were tremendously disappointed that the pandemic prevented us from doing that. When we were first engaged, we thought that would be a tremendous perk of this engagement, would be to come out and see your beautiful state and city and county, but the pandemic has prevented that for us. John Gould, who is my partner, is the chair of the criminology department at Arizona State University and is sort of the data guy of our team. I have never met John Hummel in person, nor do I have any relationship with him before this engagement, just so you understand where we're coming from. But I have worked with many prosecutors all over the country. And I want to thank Kathleen Hinman specifically for her kindness in getting this whole thing rolling and all the work that she's done in getting our contract underway. I want to tell you a little bit about our methodology in doing the assessment. Then I want to speak a little bit about the role of the modern prosecutor to put this a little bit in context. And then tell you about our findings. And I'm completely open to questions. So I don't know if you've read the report or if there's a certain part of the report that you are interested in. I don't have specific written comments. I'm just going to talk about what I know from having worked via Zoom with the people both in the DA's office and outside of the DA's office. So starting out, our methodology, John and I have used in all our different engagements, is that we start by speaking to the elected official himself, John, and getting an overview of the office. From there, we spoke to almost everyone in the office, but with certain caveats. Number one, we do not speak to anyone with their supervisor present. Number two, we give them confidentiality and promise them that whatever they tell us, we will not put their name in the report, though we will put their commentary in the report. And if you've looked at the report, there really is only one name mentioned in there, and that is the district attorney. That proviso has, I believe, been very fruitful. We had extremely candid conversations with staff both inside and outside the office. So as I said, we spoke to lawyers within the office. We started sort of with the most senior and then worked our way down. We also spoke with 2 of the 3 commissioners. We spoke to judges, police officers, and a community member. So we got a little bit of an overview. Had we done this in person, we would have come to visit you in your office, or we would have gone into a courtroom to watch proceedings. Clearly that wasn't possible, and there really weren't very many proceedings going on anyway. So I did not add up the hours, but we probably interviewed about 45 or 50 people. Usually the interviews range from an hour to an hour and a half with each person. Following that, we sort of put all our notes together, but simultaneously with that was a timekeeping component, because we're here to sort of look objectively at the office, and we can't just take their word for it that they're busy. We want to know what they're doing. So we put together, with some consultation with the office, so we understood the nature of their work, a timekeeping system. One of the beauties of being a prosecutor is that you don't have to keep hourly, time minutes as you do when you're in private practice. But for this purpose, for a month, we asked every member of the Deschutes County DA's office to keep records of their time, what they were doing, and for how long. And they did that for essentially the month of January. I think it might have gone into February, now I'm forgetting, but it was for a month-long period. We got tremendous assistance from DA Hummel's IT expert, Casey Newsom, who's on this call, who's very talented and helped us tremendously gather the information. But based on that documentation, we were able to see how much people worked and what they worked on. And so those that number crunching was what my partner, John Gould, did. This meeting happens to coincide with a very long postponed vacation of John's in Hawaii. And much as he wanted to join you here, he opted for not canceling his Hawaii vacation. So I apologize for him not being here, but he was the number cruncher of the team. And as you can see in the report, we pulled together what we believed is the current state of what the prosecutors and the prosecutor staff is doing and how long they're working. So, so that was sort of our methodology. I'm just wondering if you have any questions along that line.
So it looks like no questions. So yeah, as I say, the 3 commissioners are following you closely here, and thank you very much. Our job was to really study this document and understand what went into it. So thank you for that introduction to it.
Yes, and I'm sorry, if I was there in person, I could sort of read your body language a little better and figure out what was interesting and not. So please just interrupt if I'm going into something that is not relevant to you or not of interest. So the second thing I wanted to talk about a little bit was what is a modern prosecutor? So Deschutes County, I think, has a tremendous opportunity here. to bring real modern justice to your citizens. Modern prosecutors, when I started as a prosecutor, we were more look at an arrest and run to trial, kind of what you see in Law and Order, that get the facts, I've got the facts, I'm going to court. But the role of the modern prosecutor has really evolved over time and continues to evolve. I mean, it's no secret that criminal justice reform is a big issue in people's minds, and it is still a question of debate. There is this ongoing balance between reform and public safety. You know, where do these various important issues fall? You know, where do you find that balance? And that is going to be an interesting question for all of us going forward. But what we do know now is that modern prosecutors still have to do the daily work of proving cases, making sure that the constitutional rights of the defendants and that the cops behave properly, that victims are properly supported. All of that continues as it always has. But prosecutors are evolving into other areas, and those other areas involve crime prevention, treatment of various issues like drug addiction or mental illness, and also diversion of people who, in sort of the community's belief, would be better served by less harsher punishments. So all of these things are now becoming the province of a prosecutor to decide how these things should be done and to evolve into more of a broader view, not so narrow, not just on the evidence of a crime, but on a broader view of how to improve the community, to have people who come through the criminal justice system come out the other end better than when they came in.
So, question.
Yes.
So this is Commissioner DeBone. And yeah, you and I spent a little bit more than an hour probably together talking about this. But in perspective, and this is, you know, John's world, and I'm just learning here at this point, but when you say it like that, it sounds like the prosecutor's office takes the responsibility of community safety. And my point is, I think of it as a little bit larger, inclusive statement of, you know, public safety officers on the street, the court system, you know, the jail itself, probation, parole activities, you know, so it's a team is my observation. So could you help clarify, you know, the domain of prosecution relative to that team, I guess?
You're spot on. And I think one aspect of what modern prosecutors are doing is to work more as a team, because you're absolutely right. Prosecutor can't do this by themselves. Cops can't do it by themselves, and the jails can't do it by themselves. We must all work together. And I would argue you could even work even more collaboratively with your social service agencies or with your schools, with your hospitals. I now might be getting a little far afield, but there is tremendous benefit to working collaboratively. What prosecutors have is clout, in the sense that they are confronted with a person at probably one of the worst moments of their life. They have been jammed up for some reason, and the prosecutor is now faced with this person. And from that moment, you know, that difficult moment in the person's life, you have their attention, and you can use that to try and take them down different paths. Some people you might have to send to jail or prison because they're very dangerous. But others, you could use that opportunity to convince them to go into treatment or things like that. Yeah. So that's sort of where the prosecutor comes into the picture. But I agree with you 100%. They cannot do it alone.
But that's a great reminder. It's that moment of focus on the person in a more controlled environment, which there's two steps to that, either in the prosecutorial process or in preparing and getting to a court, because that's the focus at the judge, you know, looking down at somebody saying, okay, these are the facts and this is what we're going to do about it. So that helps me. Thank you.
Yes, yeah, and that's where you've probably heard of treatment courts. that are so effective, because of course the judge carries all this clout also. And so someone's standing before the judge and the judge says, well, look, you have a couple of options here. You know, you can go to prison, or we can send you to rehabilitative programs. And so sometimes that helps people make that choice that they would not otherwise make without that little bit of pressure. So I just wanted to put the world of the evolving role of the prosecutor into context. And I would say that the role of the prosecutor has evolved quite quickly over the past 5 years, and will continue to as we learn more and we understand how we can better help not only our victims, but also prevent crime by reducing recidivism. When I say prevent crime, if just hypothetically, if someone is committing crimes because they're addicted to heroin and you help treat them so they are no longer addicted, you're going to prevent those future crimes from happening. So there are many aspects to this. And I look forward, I'm happy to talk about, I can talk about this all day. But I do see that the DA's office in Deschutes County is on a path to exploring and expanding the role of the prosecutor into this broader vision. The other thing that I wanted to say that you commissioners know better than anyone is that Deschutes County is in its own state of flux. I looked at your population numbers, and from everything I hear, you're one of the most beautiful places in the United States. And it sounds like other people have heard that as well. And your population is really growing.
We've been trying to tamp that enthusiasm down recently.
Yes, but I actually think that the pandemic may increase it, because I'm from New York City, and people are moving out of the city in droves. They're just saying, I want to go to Bend, Oregon. They're kind of done with city life. But that is something that we had in the back of our minds, that you are not, Deschutes County is not what it was 10, 20 years ago. Obviously, you know this, and I just know it from looking at the numbers. But and there are other problems that are coming along with it. I understand from speaking particularly to the police that your homelessness issue is of great concern and continues to grow, and it's very difficult for everyone. But within that context, I just wanted to sort of say that we knew that Deschutes is growing, and then I also think that you have this wonderful community that really deserves top-notch criminal justice system. And the Deschutes County DA's office has all the building blocks to do that. But we made some recommendation as to how we believe that they can realize that vision.
Thank you so much.
So I'm just pausing if there's some more questions.
Well, the document does provide a lot of great structure, I guess, is the starting point for me. Defining each one of these programs and putting a paragraph or two behind them, because I've heard all the words over the years, but this is the document that really puts the structure to the whole office and the flow of activities, and then assigning the resources and who's available on staff. So this is a great snapshot in time for what the office is like and what it could be, reconfigured to.
Yeah. So the question, I guess, that was posed to us, and again, I'm saying this because to this day, I have not met in person any of you. So we had the benefit of being independent and objective, which is what our goal always is when we go into an office. And there are two ways of looking at things. One is, do you need more staff? Question number one. And question number two, are there more efficient or better ways to do what you're doing? So we looked at those two questions. And as you could probably see, we did recommend more staff in some areas. And then we recommended some pretty, I wouldn't say radical, but we recommended some structural changes to the office. And I can talk about both. So I don't know if you want me to talk about one or the other, or how you would like me to go forward.
So just acknowledging we do have two budget committee members in the room that may ask a question from the back of the room at some point. Just letting you know, I could see the microphone was offered to him. And then, the point, and I don't want to, be the only one speaking here today, but the struggle each year is an annual budget process. The district attorney comes in and says, we need more resources. We're like, okay, fine. How are we going to evaluate what's more resources and how much more? So this is the point where we're really putting a lot of numbers and structure for the budget committee. It's valuable to be able to see these parts and pieces. One of the things I think of is, the elbow room and the space in the office. We just don't have a good solution for that now, other than maybe a, off-site office rental, short term. So it's already a tight facility, and we've come through COVID. So I guess, the next step is, what are we going to build ourselves into in the next few years?
Yes. And I should say, and this was not our direct mission, but we did look at your courts a little bit, and they are suffering mightily as well. And I think that's a contributing cause is, they have their own issues, which we talk about a little bit, but that was not our main focus. But I do think that there are things that the court should be doing temporarily to help out. And I should say, I talked about the context of this. One more context that I wanted to mention, which is the impact of the pandemic. The impact of the pandemic has caused an enormous backlog. And it's very simply, in a criminal justice system, cases come in the door and they go out the other door. And there's a constant flow of cases coming and going. They are evaluated, and then there's a disposition. The case is resolved in some way, whether there's a conviction or an acquittal or whatever, there's a resolution. Because of the pandemic, there has not been dispositions in the numbers that you normally have. So it's essentially like you suddenly have a faucet where you've turned it down to 1/4, and only like a little trickle is coming out, and all the water is building up in the background. And that is what's sitting in Deschutes County. Now that will resolve itself eventually, but they are currently in a serious backlog issue, as is every prosecutor in this country. I mean, this is not just Deschutes, but they couldn't have trials. They couldn't have dispositions. They couldn't finish their cases, so they're just building up.
Can I ask?
Yeah, so we have a question. Mike Meyer is a budget committee member.
Yes, you mentioned it in the report a little bit, quite a bit, regarding the relationship with the courts. And in specific, there appeared to be a real problem with scheduling, where stuff gets dropped on the DA's office at the last minute.
Yes.
How do we fix that? I mean, I was a court administrator for 4 years, and I know that I had constant communication with the DA in Clackamas County. In fact, the presiding judge and myself and the DA would meet on a monthly basis. Do we have that communication, or is there a breakdown there? And then on a side note, the efficiencies that could possibly be gained if everybody shared all the information from the jail to the PDs to the parole and probation, I'm assuming, in the courts with the district attorney. And I don't sense that there's a hesitancy on John's part to share information with these folks. How do we get them off their butts to get all this stuff together to make the system more efficient?
So I'll try and answer as best I can. First, as to the communication piece, that is can be resolved in large measure through technology, and that is one of our recommendations. That the DA's office should bring in a consultant and work with maybe the courts and the police to make sure that there is this effective flow of information between parties. It's a sort of a one-time cost. but I think it will yield tremendous benefits. As to the other question about scheduling, in speaking to the judges, and you know better than I, Mr. Myers, because you've actually been there, and I didn't have the benefit of being there, but my sense was that the judges understood that it was tough to put cases off for 6 months at a time. I mean, it's just, I mean, if you think about it, putting a case off for 6 months, just if you're the defendant in that case, it doesn't seem like that's right. But they had no choice because they're being strangled by the legislature that won't give them more judges. And they believe that that's the way that they need to focus their cases. Now, I do think there are other ways to do it, but that wasn't my mission, and I didn't study it closely enough to sort of give an opinion about that. Interestingly, I'm doing something in Wichita, Kansas, where they have a similar question, and I have dug into that question, but not so much here. But one of the recommendations that we gave is that it would be nice to have, even if the legislature won't appoint more judges, if they could bring in a retired judge or transfer a judge in, particularly to help with the backlog.
That was a suggestion made, I think, last budget committee or one before, is to go out and hire or we have a dozen retired circuit judges around here. And I know we have a lot of pro tem judges, and I don't know if the county has proceeded to see if we can hire some of these guys to come in. But I think the budget committee was open to that to relieve some of the pressure.
I mean, reading your notes on scheduling, this is Commissioner Adair, and we did not meet, and I'm really disappointed that we didn't meet. I don't know when this report was due, but I would have thought we could have had time to meet. And I'm also wondering, you didn't meet with our legal either, and I think that could have been enlightening to meet with Dave Doyle, who runs the county's legal department, just for a other point of reference. But according to your document, you say we have out-of-custody cases from 2016 that are still awaiting a trial date. Well, that's 5 years ago. So as Mike Myers just clearly pointed out, we had asked to, bring some of those retired people back in and pick up the slack, because 5 years ago, this was pre-COVID. So those are just a couple of my little comments right now. And I cannot believe that I read all about the fact that we have computers in the office that are on Windows 7. It reminds me of the printer that was in my office when I first started. It didn't work. And I asked for a new one. It didn't happen. I asked IT again for a new one. It didn't happen. Finally, I said, what does this bloody thing cost? I'll go buy one at Staples. It was $189. I finally got a printer in my office that works. So, John, somebody should have been all over this for all of that equipment in your office that doesn't work. I mean, that can drive employees really crazy. And I was really sad to read that. Okay, Deschutes County, it's not like we're on a shoestring. We could have gotten you new computers. And I'm glad, what is it, June 1st is your deadline? You're going to have those all replaced, or at least a good portion of them?
I'm sorry you're angry, Commissioner.
Well, I mean, it's just like, no, it was just like, really? I mean, when you have to shut it off and turn it back on.
Commissioner, can we please treat one another with I've always treated you with respect.
Oh, it wasn't against you, John. I'm saying I feel badly for you because I know how it felt. I couldn't get a new equipment either.
I misunderstood.
I'm not putting you down. I'm just saying, oh my gosh, this is like a problem that shouldn't exist when you have a piece of equipment that's terrible. It's nothing, John, that is not against you. That is like, I get it.
We're on the same page.
We are on the same page.
I'll tell you this. It is. I think it's a sign of strength when a county is willing to bring a consultant in. Let's take a deep dive in our operations. We know when we do it. I know when I did it. There were going to be things that made me look good, and there were going to be things that showed areas I needed to improve. And so I embrace all the recommendations in here that can say how I can do better, and I appreciate the spirit that we're all bringing to that let's look at how we can be as best as possible. And so you're right, that was something that was identified. Let's improve the IT, and we're going to do it. I appreciate why you think that's so important. I do too.
Well, I just think it will make your staff feel so much more respected that if their equipment actually works.
I agree, 100%.
one of the concepts that comes up is the caseload of the deputy DAs, recommendation to add a couple deputy DAs to the system. And then from the top, the chief deputy DAs possibly not have a caseload or a minimal caseload. So could we talk that through just a little bit to understand, how that structure might flow?
Yeah. So I just want to just say one thing to the prior comments. When we come in as consultants, it's not uncommon that we see things that seem pretty obvious. And I think the reason for that is everyone who's working, including you commissioners, so you know what this is like, is drinking from a fire hose, trying to deal with just putting out the daily fires. The beauty of bringing in a consultant is we actually went around and spoke to each person and said, how are you doing? What do you need? And that's something that's hard to do in your daily work. You're just busy doing your daily work. So we do always uncover these things that it's kind of like you're going, how come you didn't know this? Well, because we were so busy, I think is the answer. But that doesn't mean that it shouldn't be done. But I just wanted to point out that, we do often find things like this. But in terms of the structure of the office, I give all the lawyers there tremendous credit. They're very hardworking. They have a strong work ethic. They believe that they should all be engaged in handling cases because that's kind of gives you the street cred to show that you're a prosecutor and that you know how to do the work. The difficulty with that is that for the people leading the office, they don't have time then to mentor and supervise the people under them. And the chief deputy DAs are from, again, I've never met them in person, but from what everyone has told me and from my conversations with them, are highly talented and well respected and are tremendous assets to the office. What we recommend is that they be freed up from doing day-to-day cases so that they can oversee training and policy decisions and restructuring the office, and so that the people below them can benefit from their experience.
Well, as I say, from my point of view, it's the concept of going from, a small county where you have a district attorney and a caseload, and then you need a second to deputy district, and then you go from 2 to 4 to 6, and now we're jumping from that 20 to something more number. So, it's really, it's amazing seeing, just like you mentioned, the last 10 years, but yeah, what are kind of structural changes? And that would be very much a structural change, to have the elected district attorney plus multiple chief deputy district attorneys in the organizational structure, and possibly not taking a caseload. And I'm just learning about it, as I say. I mean, this is the choice of the elected DA.
And I think you actually make an interesting point that we did not put into the report, but we could have, which is that this office is moving from small office to being a mid-size office with a lot of work and more coming. It's a different kind of office that it's becoming, and it's living in sort of the small town ethos.
I had a follow-up on the eliminating the caseload for Mary and Steve and hiring 2 additional deputies. And I just do the math. Aren't we still in the same position as we are right now? Case work.
That's a very good point. You're subtracting 2 and adding 2.
Back here, for 2 more.
Yes, that's why you're on the budget committee. You're good with numbers. What I think the reason it would not be that is that Mary and Steve don't have a huge caseload. They have a caseload. And so the younger lawyers could do more volume of cases. And Mary and Steve could be there to help mentor them and guide them and supervise them. It was a common theme amongst everyone that I spoke to within the office and also the judges, that there was a need for more training, and that, you have talented people on the staff who can provide that.
So I would be correct to assume that with this change, with the additional training and guidance from the chief deputies, our efficiency and our productivity would increase with, say, a net of 2 roughly prosecutors. True?
Yes. Yes, and also two trial assistants to help them. Yes.
Yeah.
I mean, our numbers said 4, but maybe we were being too conservative, but we just felt like coming in and asking for 4 seemed like a lot at this stage. But we thought that 2 to start with these other recommendations would be enough for now. Now, as your county continues to grow, and if this backlog doesn't resolve itself, I can't predict the future, but it may not be enough. But that's what we thought would be enough for now.
Can I ask those 2 chief deputies? So they have a caseload right now. We could consider reducing their caseload to 0. What kind of caseload do they have at the moment? And is it do we really would we only get the benefit of them being able to mentor more by like eliminating the caseload, or is each kind of increment that you dial down their caseload, is that a useful increment in terms of more capacity to mentor junior deputy DAs?
Do you want me to take that, Chris? This is John, or do you want to take that?
Yeah, okay, yeah, and then I'm happy to jump in. Yeah.
Sure.
But I can account
I appreciate the basis behind the recommendation, and I agree with the concept that I want Mary and Steve freed up to be doing more mentoring, coaching, training, interacting with the courts. But I do think there's a value in having Steve and Mary handle a few cases also, because when you're handling cases, you're getting face time with the judges, you're getting face time with defense attorneys, you have credibility with the people you're mentoring that, hey, I'm not asking you to do anything that I'm not willing to do myself. So I would reduce their caseload, but still have them maintain a smaller caseload. And so I do that that's still going to free them up to do the things that Chris recommends in her report. But I think there's value in having them maintaining a small caseload.
I would think they would be much happier doing that too, John.
They want to do it too.
Yeah,
I mean, they want to do the mentoring, training, coaching, but they also love doing cases.
Exactly. So you got to keep them happy because they are really fabulous.
That's right.
They've been there a long time and they work really hard. But
yes.
Yeah, I would hate to take that all away from them.
And here's this. I'll tell you this. They're popping in and out of this call because our deputy district attorneys right now are having an all deputy district attorney meeting, and they planned it, weeks in advance, and we got it on their schedules. And then, and Steve and Mary said we can do it during office hours because Steve and Mary will cover all their court hearings today. And then I dropped this meeting on Steve and Mary. So they're in court, they're popping here, they're in court, so you'll see them popping in and out. But they value having a caseload, but it needs to be reduced.
So, but I guess part of my question was, so where are they at right now? I mean, compared to like a senior, like a more senior deputy DA, are they carrying like half a caseload and then doing these chief jobs or responsibilities, or are they?
It would be. It's about 50 to maybe 60, 70% of another attorney's caseload, with all their administrative tasks on top of it.
Yeah.
I think they could be down to about 20% of a caseload, somewhere around there.
That's helpful to know.
Yeah.
Another recommendation that we made is in restructuring the office. Currently, all the other attorneys report directly up to Mary and Steve, every attorney. And we have recommended that there be another layer below them, that teams be set up, and that the younger lawyers report up to a team leader. The team leader can then report up to Mary and Steve, so that Mary and Steve are not answering every question from every lawyer, even if they've just been out of law school for 6 months. That could be handled by the team leader.
Like you're saying, let's say we compared this to a police department. Right now we have our...
Use the mic so she can hear you on the other side, yeah.
Let's say we compare this to a police department. Right now, and our prosecutors are patrolmen or patrol people. They report to a sergeant who reports to a lieutenant, who reports to a captain, who reports to a deputy chief, who finally reports to the chief. But our system right now is that they all report to the assistant chief or a captain. And so we're trying to put some line supervisors in. Is that kind of where you headed, John? I mean, like
That's Chris's recommendation.
does that make sense to you? Like to maybe we have a few sergeants out there instead of.
Oh, no, it's not. And we're close because, maybe 2 years ago or a year and a half ago, we added team leads. And so we have people who are organizing team meetings, helping with scheduling, but they're, you all know that, and Kathleen reminds me all the time, leads are not supervisors. They can't do evaluations. There's limits on what they can do. So this is just say, take the leads we already have and grant them supervisory authority. There's a price tag for that, of course. That's a higher level position that would have higher pay. But it makes sense to me that if you have these people there, that also frees up Steve and Mary to be doing more of the high-level stuff. Because oftentimes the questions are relatively minor. Like, it shouldn't be taking Steve and Mary's time. They should be taking the time developing policies, procedures, coaching, training, meeting with judges, but they're spending a lot of time on this lower-level stuff. That's still important, but can be handled by others.
Who would do the fitness reports or the evaluations?
Well, that would be determined, but I would think the supervisors, and then it'd have to be approved by Steve and Mary.
Okay.
Yeah.
Thank you.
That's my recommendation. Yep.
I can definitely see how that would have a price tag, but it seems like having more opportunities for career advancement within the office might also help with retention and morale as well.
Yeah, that's it. Sorry, Chris, if you had this in there. I don't recall if Chris had in there the issue of advancement, but I do hear that a lot from our staff. You become a deputy DA, and right now, Steve and Mary, they've been there a long time, but I think they got 10 or 15 years more, And so you're a deputy DA, and you're like, well, there's no up. Like, it's out, or you're just in the same position for the next 10 years. So this would give that opportunity for sure.
Yeah, we do discuss that a little bit. One of the things is we also recommend there's a little bit of some of the senior people have low-level cases and some of the younger people have a little more complicated cases. And we also recommend give the young people the easy cases and then have movement up through the more complex cases part of that career advancement so that you have something to strive for as opposed to just mixing up the cases and everybody having a little bit of everything.
Great discussion. So one of the other comments in here was the trial assistants, getting them possibly in the courtroom with a little bit more duties of documenting what's going on, recording, and being a true partner to the deputy district attorney. It's a legal partner, I guess, a little bit more. And that's not my world, so I don't know how to do it. But it sounds like that's a heck of an opportunity for efficiency, is my point.
Yes. So going back to what Mr. Meyer said about coordinating data systems is one thing that I found is that if you ask lawyers to be data collectors, they're terrible at it. They're busy doing their legal work, and if you're asking them to enter data, they're usually not very good. Trial assistants, on the other hand, can be very good at that, and if you can keep them in court, they can record what's going on there, be on top of it so that the data systems are accurate. Both the court data system and the DA's office systems are accurate. But the other thing that we talked about with the trial assistants is an evolution of their role as well. It used to be for a trial assistant, there was a lot of paper pushing, collecting documents, doing discovery, sending paperwork off to the defense attorney that required. But our world has become more and more complex, as has prosecutions. So there is so much more that's going on that trial assistants can help with. For example, helping to view the voluminous body-worn cameras that are now being worn by officers. Never had to look at that before. It used to be if there was a small crime, you would read a police report, it'd be one paragraph, so-and-so stole something from a store. Now you may have to look at an hour's worth of a body-worn camera. If you have a complex case, you could have body-worn cameras of dozens of officers that you have to watch. So they can help with body-worn cameras. They can help analyze downloads of cell phones Cell phones have become a tremendous source of reliable information. Most defendants have them, smartphones. You get a search warrant, and now you have to analyze what's in there. So there are things like that that trial assistants can help with. They're a little more sophisticated. I also think that these trial assistants are very talented and that they could do some more sort of low-level paralegal kind of work that might be fun for them. So there's tremendous time savings that could come from increasing the work that the trial assistants do, so you get more legal bang for the buck out of the lawyers that you have.
I had another question. You mentioned, and it came up throughout the report, the use of, and I can't remember, Harper, which is our fourth system in 6 years or 8 years or whatever.
I know.
In your experience, on a scale of 1 to 10, is the carpal system a 10, a 1, or what? And also, is there a better system out there? And last question, how much have we actually realized the use and the benefit of carpal?
I think Carpel, it's called, the acronym everyone uses, it's Prosecutor by Carpel, PBK is what everybody calls it. It's an excellent system. It's very complex, has a lot of functionality. Casey has done some very creative workarounds to make it even more functional. However, they are a national system, so they are resistant to a call. Let's say Casey says, you know, Deschutes County wants you to add XYZ. Their answer will be, we're only going to add it if the whole country can use it. Now, that's not to say that it's still not an excellent system. It is a complex system that one of my recommendations is that more contact should be made with Carpel to try and maximize the use of it, particularly in the area of victim advocates, and maximize the use of it. The second thing is very foundational, has nothing to do with the case management system that you're using. This is everybody's problem. You have to make sure that you are collecting data properly and that you're auditing to make sure that it's accurate. If you're not collecting data properly in the first instance, you're putting garbage into a case management system and garbage will come out the other end. So there has to be a fundamental review. And this is something we can talk about further. We did not go into that in detail, but that is something maybe we could do some other time for you, but that's up to you. But you have to go into far more detail about what do we call the data? Who's putting it in? Are they putting it in the same way? When are they putting it in? So that you can make sure that the data you put into your system is reliable. And I think, and again, prosecutors have been very bad at this. I see it all over the country, that this concern about reliable data is just a foundational question. But Carpel is a good system, the bottom line answer.
Chris, but you also say on page 193 of our packet that it's not only unreliable data entry, incomplete connectivity with other agencies, which hopefully we're going to be able to work on, and insufficient IT staff. So it sounds like there's a lot of things going on, and it's great to hear that it is an excellent system. So we just need to maximize our use of it.
Yes.
I don't know, do we bring in training for it? What is it that, what will help?
Well, a couple of things. Carpel, more outreach to Carpel to try and get some, you know, and I have not researched this specifically, but I do believe that they can come in on a consultant basis and help with some issues. You know, how can we make, for example, in the victim advocate area, they are drowning in statutorily required paperwork. The more that can be made automatic and efficient through the system, the more the victim advocates can actually help victims. Right now, they're busy with so much paperwork. So that's one thing. How do we maximize the use of Carpel? That will probably require some kind of contract with Carpel to get them to come in and do some more intensive training. Again, I've not researched this specifically, but I believe that that's a possibility. The second question is sort of the one that comes beforehand, which is what I just mentioned. have you figured out what data you want to enter and how are you doing it? That has nothing to do with Carpel. And I know that Casey and Mary have started that analysis. And that's just another question. That's a second question.
So you mentioned statutorily required paperwork by victim advocates. Me as a budget committee member, there's been requests for more resources in victim advocate for many years. But yeah, defining that role or defining the statutorily required actions maybe you could say a few words on that just to help me understand the
Yes.
value of that position, I guess.
Yes, I was actually surprised. As you know, I was a prosecutor in New York, and when I learned the Oregon legislature has passed a very robust victim rights law. I might be using the wrong word. John can correct me if I get it wrong. But in any case, it requires a tremendous amount of notices to victims about all kinds of things. For example, every time a case is postponed to another date, you have to notify your victim. And there is so much paperwork and notification to victims that I would say it gobbles up at least 50% of the victim advocate's time with all this. Who do we send it to? Have we sent everything? Did we get a letter back with the wrong address? And now we have to figure out a new address. And it's just very burdensome, and it's statutorily required. So it's not like you can say, I don't feel like doing it. You have to do it. But I do know, and again, we didn't analyze this part of the computer system sufficiently, but I have spoken to, for example, I just spoke to a victim advocate in Denver, Colorado. I think they use PBK, and they say it's all automatic there. So that would be a question to see if a lot of this could be done through the computer system, freeing up your victim advocates who I've now learned have pretty significant degrees in social work and so forth to do actual victim advocacy work, which they don't have much time for now.
So you're saying if we got Carpel to do the majority of this paperwork, we get the equivalent of almost 2 more victim advocates?
Well, you get.
You said 50%.
Well, I don't know the number. I haven't done that number. But what's missing, when you hear the word victim advocate, I'm sure in everyone's mind, everyone's thinking, oh, that's wonderful. They're talking to their victims. They're helping them with social services. They're seeing how they're handling their trauma. But currently, the victim advocates barely have time for that. And that's what you want them doing.
Well, and yeah, thank you very much for laying it out like that. The legislatively required paperwork and the caseload associated with that relative to other duties that we'd really like to be seeing. So, and this is good, as I say, for all of us to go through these conversations, because these are the points we sometimes, I don't know what questions to ask during a budget committee meeting to say, now, what's the justification? And you want one person or you want 4 people, but what if we give you 1? Or, there's the terminology. We need to learn about it a little bit.
Yeah. No, we have, you can just imagine, and we put this in the report, and the victim advocates do a little bit of this. We recommend replacing a victim advocate who left. We think it's very important. So number 1, try and do more, get the computer to do all the paperwork. But if you had victim advocates who could function fully as victim advocates, number 1, they could do more to get restitution back to victims. But number 2, they could work with the social service providers in Deschutes County and gather them together around joint concerns about victim advocates and be far more of an advocate for benefits for victims. And they don't have time for that now. Or they have less time for it. I'm not saying they don't do it, but they don't have enough time for it.
Great. When I see Ashley's online here, so I'm sure she's
soaking
it in as we talk. Yeah.
One of your comments on page 203 was that there was no social worker on staff, but now you're saying that you've actually realized that they do have that training. They just haven't been able to utilize it?
Yes, I learned that after the report. John did, I showed it to John and he showed it to his staff, and I did not realize that. So that was my error. I I guess, was asking what they were doing day to day, and I didn't hear that kind of work, so I jumped to a conclusion that was incorrect. So they do have more of that training, but I don't think have the opportunity to use it as much as they could, which of course is exactly what you want a victim advocate to do. You know, these are your constituents, you know, who, you know, have been put through a very difficult situation.
Can I ask a comparative question? So the analysis you've done for the Deschutes County District Attorney's Office, you know, indicates, you know, you look at the ratios, you say, you know, this much caseload, this many attorneys, there's, you know, we're understaffed. As you visit with other offices around the country, I mean, do you find other offices that are overstaffed, or you pretty much chronically, you know, like everywhere you go, you find that people are understaffed?
Well, put it this way. I think the people who hire me are concerned that they're understaffed. You know, the ones that are, you know, fat and happy probably don't need me that much. So obviously I do have a skewed view of things. But I did come from the Manhattan DA's office, and their caseloads are significantly less. So I know that there are offices who have significantly less. And I've been in offices that have significantly higher caseloads too. But I think the thing that I felt about Deschutes is that you're sort of on the cusp of having a really great office, and the push to get there is not that far.
Great. A couple of people smiling under the masks, maybe, yeah. So yeah, we are right there. I mean, the whole county's like that. It's growth, it's excitement, it's you know, raising home values, which is the awkward part. But I mean, we do strive for excellence, and there's a long history of just doing good work in a cost-effective fashion also.
Yeah, you know, I think that's a good point. You probably have many of your aspects of your county are in the exact same place, right on the cusp of moving to this next level.
Yep.
Yeah. And just to, Christina, I'm not sure how much you've heard about efforts to address the you know, the court capacity constraints here, but I mean, you've certainly heard about the capacity constraints. But just so you know, the Board of Commissioners and the county and our judges have been very actively involved in pressing the legislature for additional judges this you know, this legislative session, and we from a facilities perspective, the county is prepared, you know, has been planning and is prepared to build the courtroom space, that build the additional courthouse space that's needed to accommodate that growth, and, you know, down to we're one of the juicier items that we're dealing with right now is a whole bunch of constituent comments who are concerned about where we want to put the additional parking for the courthouse expansion. So,
I mean, your state legislature, you're giving them a gift. I mean, you're saying we're willing to buy the space. I think the argument to be made with them is, without that, think of what it's doing to defendants. I mean, if that's their concern, you know, you're a state that recently legalized drugs, you know, so it's a liberal, you know, legislature. You would think they would be concerned about defendant rights. And without having enough judges, you have people who have pending criminal cases hanging over their heads for years. It's not right.
I would agree. So maybe putting a different gear here. So this is a report that's being received by the Board of Commissioners, been previously published. There's a response by the district attorney. We're prepping for our budget process. I'm just trying to kind of bring it home about, and we could bring any other topic up, but what can we get done today, and what can we prepare for in the near future for the budget? Maybe, Tom, do you have thoughts about that?
Well, Commissioners, as you saw, John has prepared a supplemental report that goes along with Christine's report, where he is advocating to implement certain recommendations and perhaps defer some others. So in a different world, we would have done this long ago, and his recommendations would have resulted in special requests that would come to the Budget Committee for separate deliberation and approval. So my assumption is that essentially John's memo is those special requests on what he believes ought to be implemented or built into the proposed budget for next year. So we haven't made him go back and do individual request paperwork for each one, but Kathleen, in working with John, has costed each one. So we'll have pretty specific cost figures on what the implementation of those recommendations means in terms of dollars to be built into the budget for next year. So again, we weren't necessarily planning on going through all that today. That is something that we will obviously go through as part of the budget hearing in a couple of weeks. But so that would answer your question directly, is the next step is what does this mean in terms of your decision space for the proposed budget, and that would be consideration of the specific recommendations that John is proposing as a result of this study.
Yeah, and that helps, yeah, because I mean, we do have that too, but that's basically the starting point for an input to the budget, and then that'll be the domain of the Budget Committee discussion. And then John is going to, we'll have an hour or whatever we have for the Budget Committee to really kind of run through the vision.
We talked about hiring pro tem judges.
Go ahead and use the microphone again for the remote audience.
Is anything going to be done about hiring extra judges?
Commissioners, I can address that. So yes, Mike's correct. That did come up as part of the mid-year budget hearing in December. We followed up pretty quickly, and I spoke to Jeff Hall several times over the next few weeks, and he consulted with Judge Ashby in terms of what that looks like. I essentially offered to write him a check, but they actually deferred that request. They said, we appreciate the help. We can't use it now, but we will be able to use it later once things begin to loosen up with the pandemic and the ability to utilize courtrooms. And they identified domestic violence cases as having a tremendous backlog where a pro tem judge could really make a difference in terms of dislodging that backlog. And he mentioned about this time frame, like the May, June, July time frame. So we'll certainly follow up. Yeah.
Can I ask a follow-up question about that? So, so this is a budget item that has been approved. So, like a dollar amount has been allocated for this purpose.
Yeah, well, it was a directive that came out of the mid-year budget meeting in December. I don't know that we went back and appropriated any additional dollars, but there was, I believe, a dollar amount that was thrown out that we were just planning on absorbing as part of the current year appropriation.
Thank you.
The offer was made because I remember being very enthusiastic about it, and the reality is, the wave of activity hasn't come yet because of this COVID, but it's out there. You think about the warrants numbers that are just standing by. There's a point in time where the system needs to be spun up, and we want it to be able to have throughput, obviously, and then that was the offer.
And Commissioner, I need to correct myself now that I think about it properly. It's been a while since I thought of it. It wasn't domestic violence. It was, what's the term, parental judicial cases.
Oh, kind of dependency cases?
Yeah, that was it. Sorry. And they also have a additional courtroom down in the basement at courthouse.
Well, it'll be interesting to see how moving to lower risk translates to activity in the court building.
Yeah. Okay, well, I think we're winding down. As I say, I don't know, there's not really quite an agenda for what we need to get through here today. Kathleen, anything else?
I just wanted to take a minute to recognize the team at the District Attorney's
Good,
Office.
yeah, thank you.
This was, PCE did a great job and was very thoughtful and efficient in their work on the assessment and the impact that it had on the office and staff. but it is a very intrusive process. And so, the team, they cooperated fully. They were candid. They really pulled back the curtains to allow kind of this harsh magnifying glass to come in and look at their office and their work. And so, it takes a toll on everyone involved, both in time and morale. So I just wanted to thank the team for committing to that. And I think it's just truly, a humble and strong group to kind of sit back and say, how can we be better? So I just wanted to take a minute to thank the team at the District Attorney's Office and just recognize their work and effort in this as well.
Thank you.
Yes.
Well, and I appreciate it also. I mean, there's quite a crew over there referring to, there's staff and all the different services provided. We've all been through COVID, pandemic year, a year and a half almost now. This project happened on top of that. But yeah, the future is sure bright. Just a little bit of structural change, little optimizations that are documented on the page here, and however they get implemented, there could be some pretty exciting times in the future for the whole office.
Yeah.
And actually, the office turnover, I do believe that if some of, the best, ideas here are, implemented as quickly as possible, that it will really make the entire team go like, oh gosh, I do want to stay working here because I can see that things are really, truly improving. So yes, thank you for that analysis. It is appreciated. And I guess John doesn't really want an HR person, Kathleen. It sounds like he's going to borrow one or something, but since
good.
HR is so critical to a lot of decisions that Mary and Steve were having to direct, it's good if they could have a consultant or something.
We have a good partnership, and we're happy to build on that, especially as more capacity comes with senior leadership there.
Right, when they're down to 20% instead of 50.
Right.
Yeah, that will definitely be helpful.
And thank you for giving us this time. This would have been near impossible to do during the budget hearing, so thank you for this. I look forward to continuing the conversation.
So for our friends at the Prosecutor's Center for Excellence, so thank you very much for this document and kicking off the discussion as we've had here. Have you been able to see the district attorney's response letter or that has been provided?
Yes.
Okay, good.
Yes, he sent it to me, and it was very helpful and thoughtful and encouraging. And so glad that they want to take on some of the recommendations, and obviously we're happy to help going forward if anything else is needed.
Very good. And then are we at end of an agreement with you for services, or any other steps in the process? That's it. Okay.
Thank you so much for your work. It's really exciting to watch the evolution of the office to achieve that model of the modern prosecutor, and to grow from that comparison we made today, between a small office, a small and a medium-sized DA's office, and how you tinker to make that jump in the best way possible. So it's really exciting to see that in motion, all of that in motion. And this analysis really helps with the vision of that, and I believe will help with the implementation of that.
And I want to thank our budget committee, Bruce and Mike, for being here today, because we'll be spending, 4 days, 32, 36 hours together shortly, and it's nice that you were here today. I know. It's a very exciting week, isn't it?
We're going to feed you lunch, yep.
Yes, lunch every day.
Okay, thank you very much, everyone.
Thank you.
So at this time, we're going to step to item number 12 on the agenda, consideration of board approval to apply for a community-led healthcare innovation grant fund, a grant. We were transitioning from the last item here, Nahad, but now we're ready for you.
Commissioners, I think colleagues Pamela and Aaron should be let in. They're the ones leading this. There you are.
For the perinatal care continuum.
Oh,
Hello, yes.
more.
Welcome.
Pamela, I think you can get started.
I think we're waiting for Christina too.
Okay, yeah, sometimes just the names need to be mentioned so we know who to bring into the meeting, I guess. Yep, there we go.
There she is. Awesome. Yes, thank you. Thank you, everyone. Good afternoon, commissioners. Wow, I just learned a lot about the DA's office, I'll say that. I was on listening, so thank you. Thank you for that. For the record, I'm Pamela Ferguson. I'm one of the Public Health Division Program Managers at Deschutes County Health Services. And I'm here today with Erin Hoare. She's our Regional Perinatal Care Coordinator. I think you've all met her. And also I've got Christina Jetterholm on the call. She's a PhD student and graduate research assistant at OHSU. So thanks so much for including us on the agenda today. Today, I think this will be about 5 minutes. We are here to request approval to apply for a community-led healthcare innovation grant in the amount of $40,000. The funding is part of a grant opportunity provided by the Central Oregon Health Quality Alliance. It's a local agency in Central Oregon. And the purpose of the grant is to enhance community-led healthcare innovations that improve community health. And that's really what we're all about. So we feel like this is a great fit. If we get the grant, the funding will allow us to continue our evaluation project that supports our regional perinatal care continuum program. And I think many of you had the opportunity to hear about the PCC program, which is what we call it for short, during the recent budget discussions with the Public Health Division. I was told that Erin did a nice job providing some highlights as well as some justifications for why we should expand the capacity that we have to serve our perinatal clients. But this is different. That you'll hear again when Nahad comes and presents to you for the budget request. But today this is separate and just a little different. But I want to start by adding that, just a little background. The PCC program was developed and implemented back in 2016 with funding from the Central Oregon Health Council in response to Central Oregon's worsening maternal health and birth outcomes. And I'm really happy to report that the program now serves almost 60% of all the pregnant population in Central Oregon. We are now in year 6 of a 7-year grant, and we're funded through fiscal year 23. So that's really good news. But part of our long-term strategy is to ensure that the program is sustainable beyond the life of the grant. So we realize identifying new revenue streams, and we are always looking for different revenue streams to support the staff, but we also believe that conducting formalized evaluation of our program will help further support more funding and also help us replicate what we're doing here across the state. And I think that it should be a goal of ours. So if we're awarded the grant, with Christina in the lead role as a lead researcher, in consultation with Erin, we plan to do 2 things. The first thing is we want to create a comprehensive handbook. You might call it an implementation manual. And this is going to allow us to more easily share the promising practice model that we've already created with other counties throughout the state. In fact, Klamath County has already reached out to us, and they're really interested in what we're doing here in Deschutes and Jefferson and Crook County, and they really want to find out more about it. And I think they're interested in partnering with us if we do create a research model going forward. And the Oregon Health Authority Public Health Division, Maternal Child Health Section, is also really, really interested in our work here, and they continue to check in with us to see how we're doing and what kind of progress we're making. The second thing we're going to do is continue the evaluation process. And that we can do by conducting interviews with providers that we support with our perinatal care clients. And also we'll do some focus groups with staff, the perinatal care coordinators who do the work, and the OBGYN staff that we support when we're in their offices. And those will be across Deschutes County as well as Crook County. And that's really going to help us measure the effect of our program. So this is just a start, right? It's $40,000. We're going to need more funding to do a full evaluation, but just this grant will really get us kickstarted again, and it will help us package up a nice toolkit and continue the evaluation that Christina started, I want to say about a year ago. And she was doing that as a PhD student at OHSU. So we're going to continue to seek out more grant opportunities in the future, but we really feel like what we can get to with a grant like this and just the momentum is one day I think we can publish this work as an evidence-based research study, which I think is just incredible. I want to point out the budget. It's provided under fiscal implications. It's pretty straightforward. You can see it comes in just under $40,000. It will provide some funding for Erin's position, Christina's position, some graphic design, software, and some gift cards for the participants. And we should get funding. The funding award will be announced, we've been told, at the end of June. So today we're just here to ask to move forward with the grant request. And pending your questions, that's all I have, but I do have Erin and Christina on the line on the Zoom call if you have any particular questions about the perinatal care program or the evaluation process that Christina is supporting for us.
Pamela, I have a question for birth outcomes. What was the statistic in 2016, and 5 years later, what was it in 2020? Does anybody have that information? Because you said the outcomes were worsening, okay, so in 16, and I'm wondering, do we have a number from last year then?
Commissioner, we can certainly get that for you. But yes, the outcomes that we've been tracking have been improving over time, especially access to perinatal care. And we also look at healthy birth weight, and those numbers are also tracking in the right direction. But I can certainly send you something.
I just think it would be good to see that it's actually a program that I know I remember reading about it in the Health Council, documentation. But I just, just to see the improvement would be lovely. So yes.
I will. We'll send you those.
Okay. Thank you.
Commissioner Adair, I was just going to say that one fact that I have off the top of my head is that certainly compared to Deschutes County as a whole, those women enrolled in our program on average show higher access to services. So especially in their first trimester, having access to provider services is really critical for the health of the mother and the child. And certainly we have data which suggests that our program has demonstrated success in that regard.
Good. I know I remember looking at the numbers from 16, and there were lots of problems there. So,
yeah.
I think this is a very exciting proposal to share the things that you've learned in developing this model program with other communities, and also to kind of better document and provide the data, the evidence that these practices and methods are so effective and useful. So sounds like a great project. My question is actually about the grantor, the Central Oregon Health Quality Alliance, because we have seen a couple of grant proposals in the last few weeks, and I feel like they were all going to the Central Oregon Health Quality Alliance. So does that match up? Yeah.
Which is effort of the Central Oregon Independent Practice Association.
Right, and so it did. So for me, it just raises the question of how much money do these guys have, and like in how many different categories are we competing with ourselves? And you know, if we are, I mean, that could be okay, but it's just, I mean, it would be helpful if we knew if we were competing with ourselves, and you know, kind of what kind of expectations we might have about all of those projects getting funded or not. Are you going to say something, Tom?
Well, Commissioners, the other one that you saw recently, Jessica Jacks had one related to addictions. The other one was a letter of support for one that the La Pine Community Clinic was submitting.
Right. And all three of those were to the Central Oregon Health Quality Alliance.
That's correct. None of them were, well, we don't know exactly how much I don't think the clinic was applying for, but they weren't hundreds of thousands of dollars. They were more nominal.
Yeah. And I mean, this memo says that we're applying for their community-led healthcare innovation kind of category, and so I was just curious, do we know if there's other multiple categories, or are they all going in the same pot? But
Commissioner Chang, I can tell you based on the information that I have, it looks like there are 1, 2, 3, 4, 5 different categories where you could apply, and the total grant amount is $200,000. With award maximum per applicant $40,000, which is what we're asking for. And that's for this particular grant.
Well, this will be the third one that we're advocating for, just to let you know. We could be competing against other interests that we're supporting also.
Hopefully those three are the only three.
Yeah, there we go. So yeah, this is a request to do the application for the grant fund. So is there a motion?
Yeah, I'll move board approval to apply for a community-led healthcare innovation grant from the Central Oregon Health Quality Alliance.
I'll second it.
Okay, any other discussion? Seeing none, Commissioner Chang?
Yes.
Commissioner Adair?
Yes.
And chair votes yes. Thank you very much. When we receive the grant, we'll talk about it more and see what the next steps are.
Yes, we'll be back. Thank you so much, Commissioners.
Thank you.
Thank you for your great work.
Item number 13, consideration of signature for IGA with OHA and a resolution extending FTE within the budget. Nahad.
Thank you, Commissioners. There's no way I'm going to start without Cheryl. So.
Oh, okay. Yep.
Cheryl
Smallman. This is the money part of the job.
Yeah. Thank you, though. Still no Cheryl. Huh. Let me text her to make sure she joins.
She's coming.
Coming in now. Yeah.
All right. Great. My heart is always dropping.
And Dan. Okay. Yeah. Hello. So yeah, Nahad didn't want to do all the money stuff by himself. He was really looking for your assistance.
Absolutely.
Here you go.
Absolutely. So thank you, Commissioners, for accommodating us. I echo what Pamela said earlier. The first hour was really, after lunch, was quite educational for me, and it really reminded me that I deal with one problem and on a daily basis, and you're dealing with 10 problems on a daily basis, or maybe more. So it was quite humbling to listen to the challenges and, of course, opportunities throughout our county. Commissioners, we are here to request your kind consideration to approve receiving and allocating around $2.9 million COVID-related funds from Oregon Health Authority. These funds are being distributed through the Communicable Disease Framework or Agreement, which is OHA number 159809-22, with a focus on COVID response. Now, before we get into the details, Commissioners, let me acknowledge that we all want this pandemic to be over. We are exhausted, and believe me, none of us want to spend one extra day on COVID than we have to. And as we heard this morning, especially from Mike Johnson's presentation, we're not out of the woods yet. So as the OHA guidelines stipulates, and from our technical point of view, we propose to use these funds to maintain, and these are external funds obviously, to use these external funds to maintain staffing capacity and flexibility in rolling out vaccines, especially when booster doses will become available, that's inevitable, and facilitating culturally appropriate testing, wraparound services, investigation, tracing, and community education. These are all criteria within the agreement. It is possible that we don't necessarily need to use all the funds for the proposed positions, majority of which have been approved already, if this pandemic goes away. So in that case, we can certainly divert the funds based on your guidance. However, I have to say that as a public health director, I have to think about the various good and bad scenarios and ensure that we have adequate capacity and flexibility in our system. So the proposed strategy, commissioners, is much like an insurance policy and specifically proposes to use the funds to cover 19 positions for varying timeframes. 18 are current positions already approved, and 1 is a new position. So for your consideration, we are proposing that 7 positions are approved or extended as, which would function as a strike team. This is sort of the first line of defense for containment and or transition to leading temporary staff if there is another surge or surges. 6 positions are to function for emergency or incident command structure positions. These are leadership and technical and operational and administrative, and most of which are intended to terminate end of this year. And then 6 positions are foundational gaps, are addressing foundational gaps where department needs were basically exacerbated by this COVID-19 workload. Most of those are also included in the fiscal year budget planning process, and these funds are being proposed to cover those positions. Some of the key activities are, of course, provided in the agreements that have been perhaps shared. But some of these key activities over the next 2-3 years include vaccine distribution, testing, investigation, and contact tracing, cultural and linguistic support, access, community education, community call centers, wraparound services, medical, clinical guidance and direction, administrative support. So in summary, Commissioner, before I give the floor to my colleague, we believe that these positions are in line with the OHA guidelines and to our best knowledge and understanding can deliver on the grant requirements. We have learned many things from this pandemic, with one of the key lessons learned to be flexible and nimble. That means having the infrastructure in place to quickly scale up or down and either directly respond to the needs themselves or lead groups of people to address the need in the event of a surge from week to week. We believe that the staffing proposal gives us that ability. So I give the floor to my colleague Cheryl, maybe.
For the record, Cheryl Smallman, Business Officer for Health Services. So what we are here today to ask of you is to consider signature of document number 2021-316, which is an amendment to our intergovernmental agreement with the Oregon Health Authority. That agreement in total will provide $3 million, $3,071,331 to be specific. So to pair that with the $2.9 million that Nahad was speaking about, which is specific for COVID funding, it also includes $110,000 for school-based health centers. Of that $110,000, $76,000 came before the board and was accepted for school-based health centers just in March of this year, I believe. And $34,000 is carryover funding for that will be provided to our medical sponsors at those sites. Included in this agenda item is Resolution 2021-028, which adds the Community Health Specialist 3 position, if approved, as well as extends the limited duration positions, 11 of those limited duration positions. And on the staff agenda, we have outlined the 19 positions that Nahad spoke about and the action or extension dates that we are requesting. So with that, I'm happy to answer any questions or provide additional details.
Thank you so much. Quite a comprehensive picture of future services. So the state in their element items are providing these funds. As we heard today during our COVID update, this isn't the end of it. We're going to need to do some management out there into the future. So it's a good time for that. And then also, Had, as you mentioned, there could be a balance of some of these positions over time for the current activities required. So, and then about the 3 pages into it, I see that we changed the whole concept of committing to future funding and leaving it to just future funding possibilities, which I really appreciate, because that's definitely the item I was just questioning last time around. So. Any thoughts?
So Cheryl, you just gave 2 numbers that were like 2 million. Could you repeat those numbers again, please? Because I'm looking here and it says it's a total, this is money that's coming from the state, the $3,071,331. But you also said another $1 million number. Where is that at?
There was 110,000 in that 3 million.
Right.
Specific school-based health centers.
Yes, I got that.
I do not recall.
Okay, so we're looking at 2.339129, $2,339,129. Okay, so that goes into what we're talking about. It's not anything more. And what do we pay contact tracers an hour? I heard we're spending $40,000 a week on them, that the state is funding us. Is that correct?
So what we have is a cohort of temporary staff and contractors who work in various areas, including testing, vaccination, call centers, and contact tracing investigation. They've been trained to be flexible and agile and respond to the need of the moment. The payment for temporary staff varies depending on their qualifications and the scope of work, Commissioner. So I would have to sit and basically break down exactly the type of person responding to the type of work and give you exact figures.
So we do have 30 people doing contact tracing per our original calculation from, what was it, May 15th of 2020, when we were told we needed 30 because of our population?
We expanded our capacity with temporary staff and contractors to address the surge that was going on following the Labor Day weekend or the Labor Day holiday. And following that period when basically we had a drop in cases, it coincided with the same time where we had the emergency use authorization for vaccines and we started the vaccination rollout. So a number of our temporary colleagues were diverted to support the vaccine rollout, plus the call center, which was getting slammed with phone calls. And then again, because we had the flexibility in the system, when we had the surge again with the cases, we had to shift folks around to address some of that situation as well.
So how many people yesterday were working on contact tracing?
I'm not sure about yesterday, Commissioner. I think we have around 20 to 25 temporary staff right now. And they're not all being, by the way, when I say 20 to 25, it doesn't mean that they're full-time. They're temporary staff for a reason. They're accommodating their family situation. They might have kids at home, so they can only work a certain number of hours. I do believe we have around 20 to 25 temporary staff, which we can tap into for a varying amount of time, depending on the situation. A lot of them are part-time. A lot of them might only work on weekends, some on evenings, because of the family circumstances.
No, I just thought I was told last week that we were spending $40,000 a week on contact tracing.
It is true that we are spending between 30 to 40,000. Sometimes it goes up, sometimes it goes down. That's not just on contact tracing. That's on temporary staff, some of whom, for example, John Allen right now is supporting the vaccine rollout at the fairgrounds. We have a number of staff in call center, for example. So it is true that we are spending that amount from external funds on temporary support so that we can expand and contract according to the situation.
Okay, and this state is reimbursing us or advancing us all those funds, correct?
The support for these positions has mainly come from external funds, the state federal funds that are coming our way. Cheryl, did you want to weigh in?
It depends on the activity that they're doing. If it's contact tracing, that is being supported through state funding. If they are working for the call center directly helping with vaccine information, we're able to request FEMA reimbursement, which will also go through the Oregon Health Authority.
Thanks, Cheryl.
Great.
Well, I think this opportunity is really exciting. We have, the state is essentially advancing, or not advancing, but agreeing to reimburse us for a substantial amount of costs to address communicable disease challenges in our community. The most visible and top of brain of which at the moment is COVID, but we certainly have a lot of other communicable diseases that we need to tackle within our community. And I'm really glad that within the framework of this agreement, we have the flexibility to redirect those resources, these dollars, those people, to other communicable disease needs as the opportunity presents itself. And I too really hope that COVID, we don't have a worst case scenario with COVID, and we can use some of those resources in other ways. I also am under the impression that there's some urgency around this item, both because there are limited duration positions that are winding up fairly soon if they're not extended, and also that we need to get signatures or get a board chair signature on this agreement if we want to take advantage of this opportunity in fairly short order. So I don't have any additional questions. I just wanted to express that I think that this is a very I see this as an opportunity for us, and I'm really glad that the public health staff have thought and the health services staff have thought so carefully about how we take this opportunity, convert it into the capacity that we need to deal with our challenges, and also how have thought very hard about how to make these resources as flexible as possible so that we can use it for the highest priority needs that we have. So thank you.
Is there a motion?
Yeah, I'd like to move to approve chair signature on document number 2021-316, an amendment to the intergovernmental agreement with the Oregon Health Authority and consideration of resolution 2021. I hope I'm doing this motion right.
Probably approval of that resolution.
And approval of resolution number 2021-028, increasing and extending FTE within the 2020-21 Deschutes County budget.
Those are two documents.
Okay. So that can be made together?
Yes,
Should we do it separate? Okay.
they can go together.
Okay.
Okay, I'll second it.
Okay. So one comment, this is very much a dynamic of that the world of change in the health department, just like I've always said. I mean, it's amazing how many parts come and go, many times a year even. Hopefully there's stability for those careers, but some of them are truly limited duration. But I appreciate everybody working in, the department with the efforts providing for the health of the community. So this is an example of change, managing change. Any other comments? Seeing none, Commissioner Chang?
Yes.
Commissioner Adair?
Yes.
And Chair votes yes also. Thank you.
Thank you.
Thank you, Commissioners.
Item number 14, consideration of board signature of document number 2021-323, Pacific Source, CMHP. Janice Garceau.
Good afternoon.
Yes, thank you.
Good afternoon, Commissioners. For the record, Janice Garceau, Director of Behavioral Health. I believe Cheryl Smallman is in the offing in case she is needed, just so that you're aware if you have questions about budget. But I am here today to request board approval and signature of document number 2021-323, which is the Pacific Source agreement for the services provided by the Community Mental Health Program. As you know, Pacific Source is the coordinated care organization that manages the Medicaid spend to provide key behavioral health services in the community, and as such, they contract with us as a designee of all of you, the local mental health authority, to provide required behavioral health services to community members. The contract this year is not profoundly different from last year. There are not major significant changes, although they did move some component parts around. What is different, well, what is significant is that there was not an increase in the contract amount this year. That really was across the board because the CCOs did not have additional Medicaid revenue to work with this year. So it was a bit of a flat budget year. The amount represented there on your agenda item that says 8.8 million really only represents a portion of the year. The annualized amount of the contract is roughly the same as last year, somewhere between 11.8 and 12 million total. But for the contract period represented through the end of this calendar year, the estimated revenue generated by this activity is 8.8 million. There are performance metrics associated with this contract. We now share in the risk and the risk pool and the savings benefits. So if we meet contract metrics and if there is savings to the overall health budgets, the CMHP receives a small portion of that and also shares some of the risk. It still remains to be seen the degree to which the OHA is going to actually hold CCOs accountable to the quality incentive metrics this year, because they are taking a second look around June to see whether or not the impact of COVID and the associated closures and reduced service levels may impact communities' ability to meet the quality incentive metrics unfairly. So we still don't know what the outcome of that deliberation is going to be.
Okay. So, yep, pretty big contract, big part of the services we provide, but it sounds like it's pretty standard also from what we've done in the past.
Correct.
Yep.
Yeah, the heavy lifting on this contract was in years prior, and Janice did a lot of that heavy lifting.
Great. Yeah, that's a good point, because this was, we couldn't get it landed for quite a while in the past, but now this is the follow-on from the agreements in place. Great. Any questions?
This was the one you might remember, Commissioner. We came back monthly for extensions and extensions.
And monthly, right?
Yeah, we did that, I think, 12 months straight at one point, if I'm not mistaken. So this is really a very stout document. Like I say, Janice represented the county's interest tremendously over the years in this, and we had a great negotiator at the table with her.
Thank you. I had your help, and I had Dave Inbody's help, actually, who really did a lot of heavy lifting too on the front end. But
is he still with the state, Janice?
Yes, he is still with the state.
Okay. All right.
We have a friend in Salem. And I don't know what else to say about this. I mean, this agreement, I mean, it seems like this is a foundational piece of the work that we do, you know, as a CMHP. And now that I've heard a little bit more of the history of how much work went into this agreement, I have even greater appreciation for how tidily packaged and clear the whole thing seems to be at this point.
Thank you. We just started, ironically, the contract negotiation discussion for next year's contract today. So ironic that it comes before all of you today, because we literally just began what will become probably an every other week commitment for the rest of this calendar year as we work towards the next year's contract.
Yeah. It will be applicable then January 1st? It's calendar.
It is one of the things that happened with the contract, and Dave Doyle will be familiar with this, is that because we had this experience of a monthly renewal, it is now an auto-renewing contract. That is a good thing for us in fiscal years where we benefit from an auto-renewal and not necessarily getting it finished by January 1st. It potentially could have implications for us in a year where we might be negotiating for increased revenue. So that's just something we always keep an eye on. We hope to get it executed in January. It is incredibly rare that actually happens. This year there was no impact on us. Last year, if you recall, they agreed to retroactively increase our rates to make up for the fact that there was a late signing date. So it's just something we keep an eye on in the negotiation process.
Was there a motion?
So move board signature of document number 2021-323, the Pacific Source CMHP.
Second.
Right. Any other discussion? See none. Commissioner Dare?
Yes.
Commissioner Chang?
Yes.
And chair votes yes.
Thank you, commissioners.
Okay. Thank you.
Have a good afternoon.
Yes, you too. So that's the end of the published agenda. There are other items to be brought up. Looking at the calendar, I could bring up the concept that like this Friday, I could be at a Lapine Chamber breakfast instead of a legislative meeting, and I'm not saying that's the priority, but also the next week, I have something that popped up at that 8 o'clock time, and that's the day before holiday weekend too. So I don't know if there would be any, so I guess it was a NACO task force meeting that was going to schedule it right at that same time. So the next 2 weeks, I've kind of getting double booked on these Friday mornings. And legislative meetings, the priority, I'm just bringing it up.
I mean, I don't necessarily feel like we've been, that last couple of legislative meetings, just kind of at this point in the legislative session, I don't feel like there's been a tremendous amount of, you know, the real detail to work on bills or budget bills, you know, teeing that up for us. So I don't.
Maybe bring it to this board, you know, these meetings instead, just have a topic.
Yeah, I don't know. I mean, you know, for example, this morning I testified on to the Joint Ways and Means Subcommittee on Natural Resources about the Oregon Department of Forestry budget, you know, an item which I think is of, you know, extreme importance to Deschutes County, but it wasn't something that our legislative, our lobbyists teed up for us or anything, and so I don't. If we skip some of those legislative meetings, I don't necessarily think it's a major loss.
This is just, I'm just bringing it up now, we don't even need to make decisions, but I just see myself getting double booked on these Friday mornings all the time.
So we should make a decision tomorrow, right?
Well, for this Friday, and as I say, I mean, are there any, because we could bring it up on Monday afternoon next week too, just during our regular meetings.
We could, probably would make sense.
So that's an idea. I didn't know if we'd go this far, possibly canceling a legislative call Friday morning, maybe touch base with Whitney, and then moving any items to our Monday meeting.
She's probably listening in.
Yeah.
But yeah.
I'm sure our team would appreciate it.
Okay.
If the legislators,
Yeah, oh, no, that'd be the priority.
If the legislators haven't been able to make that time, then there's not. I mean, there's not a real strong need for us to be rigid about when we're doing that.
So would you like I'm hearing cancel Friday, an actual item then agendized for Monday afternoon's board meeting for a legislative update?
So I think of it as, legislative update for items that are ready, as in, it wouldn't be an hour meeting with all staff like we've been doing, but any topic that we can find that's timely on Monday afternoon.
And if
Phil Shoyers might not be available, I don't know.
If there happens to be a hearing or something on Monday, then we'll send you advance notice of that by Friday.
For sure.
I do feel like we're moving from a phase when we saw a lot of policy bills to now a lot of the action is in the budget bills. And I don't think the way that we've been running our process, that we're really tracking the budget bills and thinking about what expenditures, what budget items, state budget items are really important to us, and aggressively weighing in on those. So I mean, that's part of, if in the last few weeks our to-do list coming out of those meetings has been light, I think it's because the legislature is mostly working on budget things right now, and we're just not necessarily weighing in on budget things. And perhaps we should be. So.
Isn't today Revenue Day for the state? Are we supposed to get that number out today? So has anybody seen anything?
That's probably why it was quiet too. Now it'll be full speed ahead.
Right. I haven't seen anything.
I mean, there have been a lot of budget hearings.
No, but I meant as far as the big numbers.
Yes. Yeah.
So where are we at? I know I hear they're taking some of our kicker.
Action-wise, Monday afternoon next week instead of Friday morning this week. If there's any actions that we could be involved in Monday morning or before that, let's just do it through email from staff, and we'll go from there.
Yeah.
But I mean, I don't have an expertise in which budget to follow and who's ready for input from a commissioner. So if you have any thoughts on that or a line of information for us, let's all learn.
I mean, I would maybe more just flag that for next time. Like next time, the way that I don't know how we structure our contract with PacWest, but I mean, telling them that's we're specifically interested in those kinds of legislative advocacy opportunities as well. And, they can, I'm not an expert in all these joint ways and means, processes either, so.
Well, and if Whitney's listening, she can share it with Mr. Shoyers right now. I mean, we may have good information Monday afternoon.
Yeah.
I mean, to address your point, Commissioner, we haven't. That's not in our contract for them to analyze budget bills. We, frankly, historically, not that it's right or wrong, but historically we've relied on our department staff to alert us if there's a piece of an agency budget that has an impact on our operations that then would get raised to the level of advocacy on our part. So it's really structured more for us to advise the lobbyist what we want them to lobby about, as opposed to the lobbyist alerting us on things that we might want to take a look at. But again, that's not saying that's the right way to do it, but that's historically been our process.
Okay.
Okay.
Understand.
Great.
Thank you.
I'm glad I brought it up, so I'll be at a chamber breakfast on Friday morning then instead of
Very
the other thing, yeah.
Say hello to everyone for us.
I'll try, yeah. So we were provided some pages up here, introduction to the topic, or I guess.
Sure, yeah.
I'll acknowledge it, yeah.
It's, Nancy had shared with me prior to the election that this was going to be coming, but asked me to sit on it until after yesterday's election. She wanted to get that in a rearview mirror. And so she came down this afternoon, right before the meeting at 1, and provided me, to provide to you folks, a copy of her letter announcing her retirement and her recommendation on an interim replacement. I gave you a brief little cover memo that provides what the process is per ORS. The election for the new clerk would be in November of '22, with that person taking office in January of '23. So the interim appointment would hold that position until January of '23, when the newly elected clerk would take office. You're not required to appoint the person, but the clerk does provide a recommendation. The board can decide how they want to go about moving forward with naming the interim person. There are certain requirements in order to hold the office, but your hands aren't tied. In other words, you don't have to go with who she recommends, although it certainly carries quite a bit of weight. And I'm not aware of any clerk that's resigned, retired, and then identified a replacement wherein the replacement wasn't the person appointed. But again, you're not compelled to do that.
Okay.
So you could decide what type of process you want to have beyond that.
Well, yeah, so let's acknowledge it. So this is the official notification from our Deschutes County Clerk to the Board of Commissioners, saying that her last day will be July 31st, 2021. And she's got a letter to us stating that she started working at Deschutes County on January 1st, 2003. Yeah, I don't know if somebody wants to read the letter, or how do we want to proceed right now? Or, I mean,
she will be definitely missed. An amazing service to our county. The woman goes beyond. She delivers ballots. She does, I guess she had to deliver books to, Lapine didn't get
pamphlets, yeah.
Yeah, they didn't get the voter's guide. So, yes, it will, she's definitely, we need to plant a tree in Nancy's honor. So, anyway, no, she's been wonderful, and the fact that she's recommending Steve Dennison's. Steve and I were in county college together, and he's an extremely hardworking person, and it's nice to see his name on this letter from Nancy, that she feels he has the ethics and the competency to continue on in that fine tradition that she's done for all these years.
Yeah, when Nancy mentioned this to me just recently, I just turned to her and I said, Nancy, you're the guardian or the steward of democracy in our community. You can't retire, but Nancy has a lot of life things that need tending to, and I think I'm sure all of us just wish her all the best, and we'll look forward to working with her these next couple of months until her retirement. And I guess I want to ask what our processes are. I mean, that this recommendation on an appointment, I mean, do we act on that today, or do we?
No, I wouldn't
we
recommend
make it
acting on it today. I mean, I give it some thought how you want to process it. I've worked for boards of commissioners that solicited people that had interest and then did interviews and ascertained who they were going to appoint. I recall when Larry Blanton retired, he identified Shane, and that was the extent of it. The board didn't do anything beyond that. There wasn't any further solicitation or vetting. So really, it's the statute relatively silent on what process, if any, you employ. It just says you need to appoint the interim person. So how you choose to go about that, again, whether you take the recommendation of the person retiring, whether you open it up to a broader interest, that's going to be completely up to you folks. I recall the one in that I was involved with the clerk in Polk County a number of years ago. they did open it up, as I recall, to people that had some interest, and I recall right, it was just the person that was identified as the replacement was the only person that indicated any interest. There are some qualification requirements that might have been an impediment, I'm not sure, in that case.
And so this will be an appointment of an interim. I mean,
that's the title.
Emphasis, interim county clerk that will serve until the end of the term. Yeah,
And Nancy's current term would end,
January 2023, or
yes, the person elected at the next election for clerk, which is November of 22, would take office the first Monday in January of 23.
So this interim will serve for a year and a half.
Approximately, yeah.
Okay.
So I support, we'll receive the letter announcing a retirement at this point in time, and then future actions to be taken for an appointment of an interim clerk will be a future agenda item. But Nancy's a very special person. Everybody smiles when Nancy's around, and she's always smiling also. My experience is years ago, just knocking on doors as running for office, I ended up talking to her mom. And so then we see each other at the county fair once a year at the breakfast, and we just get to say hi to each other every year. So it's just really special little connections like that to make a great sense of community. So, but Nancy's also given us a lot of confidence. When you hear about possible voting irregularities or audits happening, I always celebrate the fact that we're not in the national news when we have elections. So, that's the job. So,
no, and I mean, she's well respected around the state. I mean, when they need a county clerk to give a presentation about something, they call Nancy Blankenship. So, big shoes to fill.
Well, thank you, Nancy. We've received your announcement. Anything else? Other items?
I don't think so.
One other thing to flag in terms of future agenda items, we did just this afternoon receive the letter from the Deschutes Basin Board of Control requesting a drought declaration. So we'll look forward to. Won't look forward.
Once again, look forward to.
We will. It will be good to act promptly on.
There you go. We'll act promptly.
So, Commissioners, just FYI, those typically come through Sergeant Yerby, our emergency services coordinator for the county. So I did see that briefly this afternoon. I will forward it to Nathan, and he's the one who would typically package that up and bring it back to the board for approval.
I do have a question. I took my health packet upstairs from this morning. Okay, so I thought a 83-year-old woman died. Was it two women or a man and a woman?
It was two females.
Okay, because according to OHA's report today, it was a man and a woman.
Well, that's another one probably, though.
I think there's but then, anyway, didn't it say yes? Two women, and that's not what the health authority says. So I think we've got something to track down there.
Okay. So seeing nothing else, we do have 2 executive sessions for today. So at this time, we'll go to an executive session under 1926602E.
Oh, cookie. What is it doing out there? Is it kind of like...
It's looking like it.